COVID couldn't stop us, and justice won't wait. It is time.
Welcome, y'all. Let's get into it.
We have work to do.
We are taking our message to Washington, D.C. We've been armed with data and information and a plan.
Because folks are marching everywhere.
But it will take all of us together.
This is Congresswoman Robin Kelly.
Congresswoman Ayanna Pressley.
Congresswoman Grace May.
Senator Chuck Schumer.
Please join us at NUL.org, as well as the National Urban League platforms on Facebook and YouTube.
Your wisdom is going to be crucial, and I appreciate you.
I want to welcome everyone back for day 2 of our 17th Legislative Policy Conference and let you know that our work is so critical and important. And while once again, we could not meet in person this year, it was so important that we continue to elevate our advocacy and those issues that we are concerned about through this virtual platform. We want to thank our partner Verizon for all of their generosity and support, and also thank all of those who participated in day 1 as speakers and presenters, but especially thank you for joining us for this very important engagement. As we approach day 2, we keep in our memories and in our thoughts Ahmaud Arbery, Breonna Taylor, and George Floyd, victims of unnecessary either vigilantism or police violence, that our work is now defined to bring about justice for them and to reform the systems that allow what happened to them to happen. Now, we had a great day in day 1 with some exciting discussions, substantive discussions, and discussions which I hope left you energized and looking forward to more. Before we go on, Clint, I'm real interested in whether you have any highlights and maybe share with us a recap of day one.
Mark, I'm not sure how we just pick one topic. The sessions yesterday were riveting, starting with 5G. I think a lot of people may have thought 5G was an R&B band, but I think we learned it was something far more important. It's the way that we will communicate in the future. It's the way that we will work. It's the way that we will communicate with each other and that machines will communicate with each other. It's basically the future of communications. And I know I learned a lot. I also really enjoyed the session on social action and police reform. This is such a relevant and timely topic. I'm glad that we got to talk about it front and center. Criminal justice reform, your talk with the executive vice president of Verizon, Craig Silliman, and other guests, I thought was a keen insight into the way that we should be thinking about criminal justice reform. And of course, it helped that right after that panel, we heard from the Congressional Black Caucus, whose 54 members are going to be critical to enacting any sort of substantive reform on the police side, or the criminal justice side, or the economic side. The so-called conscience of the Congress gives me a lot of hope that we're going to get there. Finally, I learned a lot about the gig economy. I certainly hope that we all can rest comfortably in the jobs that we have, but this gig economy is coming at us whether we're ready for it or not. It seems to be the future of employment, and Urban League movement better be ready for it. I thought that session was incredibly informative. And then finally, for those of us who are at home with kids, struggling through distance learning, students in college who are trying to get their classroom instruction online, the stability and the bandwidth and the future of distance learning is here. It's not in the future, it's already arrived. And so talking about how we train our teachers, how we train our students to be ready for this radical shift in education, I thought was well worth the price of admission.
As we look ahead to day two, we have several critical sessions on tap that go straight to the core of the National Urban League's mission and are crucial to the communities that we serve. We're going to look at the status of COVID-19 and how to make sure that the recovery is beneficial to all, and that African Americans, we have and participate in our share of economic relief. We have several members of Congress on deck to update us on the progress. This is also a day for democracy, voting, and representation. Our Reclaim Your Vote session will address efforts underway to ensure maximum voter access and participation in November. The challenges are unprecedented, but so is our resolve. The census is underway, and we've got to make sure that there is a full and accurate count. An accurate count is a must if our communities are to receive the federal allocations and representation in the government to which we are entitled. Join us for Make Black Count to get clarity on the census and how to get people counted. There's a lot more, so keep your eye on this space. And remember, throughout the day, we're engaging our representatives and raising awareness with Phone to Action Interactive. Clint, explain the process and help everyone who's on this virtual session to understand how it works.
Thank you, Mark. And for those of you who have access to a mobile phone or a computer, it's quite simple to activate a message to all of your members of Congress. The first thing you do is type the keyword LPC 2020 to number 52886. By doing so, you will receive a text message that will allow you to fill in your name and your email address and send a message directly to your House of Representatives member or senator to tell them about the initiatives that are important to you and the initiatives that are important to the Urban League movement. It's quite simple. Again, and you can also see it on the screen, type LPC 2020 to number 52886. It's as simple as that.
Thank you very much, Clint. And I want to thank all of our sponsors, those who've enabled us to be with you over the last 2 days. There's Verizon, our presenting sponsor. Thank you, Verizon. T-Mobile, Lilly, Lyft, Walmart, and Wells Fargo have joined to sponsor various sessions throughout. We want to thank them for their continuous engagement with the work of the National Urban League. Now it's time, yes, it's time to take our message to Capitol Hill. And again, thank you for taking part in this, the 17th Legislative Policy Conference. Stay safe, stay healthy, go forth, and be effective. Be heard. If we're out of sight, we're out of mind. Thank you, urban leaders.
For more than a century, the National Urban League has promoted economic opportunity and addressed racial injustice. Today, we are empowering communities and changing lives through our 90 affiliates, serving 300 communities in 36 states and the District of Columbia. Welcome to the National Urban League.
In the conversation, we are starting the conversation. We are leading the conversation.
Now let me ask you a question. Did you know each year the National Urban League serves more than 2 million people? Through our signature programs, we continued our work as a direct services organization, offering after-school programs under Project Ready, job skills training through our workforce development program, comprehensive home ownership preparation. We help struggling students enroll in college. We help the formerly incarcerated build the skills necessary to secure family-sustaining employment through our reentry program. And we do this at no cost to the community. Did you know? While our reach and effectiveness continue to expand, our efforts, initiatives, and programming remains laser focused on education, jobs, housing, health, and justice. We are committed to improving our communities by giving a voice to the voiceless. We were on the ground March 24th at March for Our Lives, a student-led demonstration in support for tighter gun control that took place in Washington, D.C., with over 800 supporting events around the world. And in a political year like none we've seen in at least a generation, we lead activations across the country through our civic engagement campaign, Enough is Enough, Vote. Finally, let's take a look at one of our major campaigns, No Ceilings on Success, an education campaign centered on arming parents, teachers, and community leaders with the tools to help close the education, opportunity, and achievement gaps. This campaign also holds states accountable to the Every Student Succeeds Act, a law that helps level the playing field by reducing racial disparities in education and putting more control in the hands of parents and concerned citizens. By design, No Ceilings on Success elevates the voice of the people and empowers them to advocate for children and their communities. And what better place to start than by asking the hard questions?
We've made a lot of progress over the last decade. We certainly have the highest graduation rate from high school we've ever had as a country. That said, we have a lot of work to do.
Public school system works. I am a product of the public school system, and so it is our duty and obligation to hold our states and our country accountable when they don't fund our schools properly, and to call them out, elected officials included, when they claim to care about our children, but they don't put the money or the resources behind that.
No Ceilings on Success works in tandem with our Equity and Excellence Project that supports local, state, and national education advocacy, engagement, and reform.
We have to have environments that nurture our children and that are offering the kinds of support to their families that children and families need today.
You need to get involved and join the Urban League.
You can support your local Urban League as a volunteer, a young professional, or a member of the Guild, or make a donation to the National Urban League as we continue to empower communities and change lives.
Hey everyone, it's Mike Sievert, CEO of T-Mobile. It's such a privilege to be with you today, at least virtually, at this 17th annual Legislative Policy Conference of the National Urban League. This meeting could not have landed at a more timely moment. The recent injustices perpetrated against Black Americans all across this country continue to weigh heavily on me, and I know on the hearts and minds of anyone who truly loves this country and wants to make it better. I feel as a society, the events of the last month have shown us a huge opportunity to improve. It's an opportunity that's always been there, of course, but many of us weren't seeing it clearly until now. And opportunity often follows adversity, but it has to be done deliberately. If we don't let this moment pass, we can create opportunity and address systemic racism in a much bigger way. Obviously, racism, hatred, and inequality don't belong in this world, but we know they're real, and we can't just wish them away. We have to take action if we want progress. At T-Mobile, we know our culture is stronger because of the different backgrounds and life experiences of our employees, but we also understand that we really need to do more to combat the systemic racism that infects our organization and really most large organizations. That means making sure everyone feels safe having the right conversations, but it also means advancing beyond conversations and into action. T-Mobile is prepared to step up and step out and speak out to help bring about change, both inside and outside our company. It comes down to things like how we hire, how we recognize and reward employees, how we develop and mentor new talent, how we promote our leaders, just to name a few. And I know it starts with listening, and we have a lot to learn from our friends at the National Urban League. That's just one reason why we signed a partnership MOU with the Urban League and several other leading civil rights organizations, with conversations featured right here at this conference. Our partnership is all about building and expanding on T-Mobile's already nationally recognized diversity and inclusion initiatives. We've made serious and significant commitments to you to improve the diversity of our leadership and workforce at all levels of our company, including our board of directors, to better reflect the diversity of the communities that we serve. We've also made commitments to improve diversity in other areas too, including procurement and supporting diverse entrepreneurs, reaching low-income consumers with outstanding wireless services, including 5G, and of course, philanthropy and community investments. But all this is just a start. We're focused on making concrete steps forward, and it's long past time for real change. As we look forward to our continued partnership, we're all really counting on your leadership at the National Urban League and your guidance at this critical moment in time. Thank you for all you're doing, and I hope you have a great conference.
We'd like to welcome you to our current session entitled, What Now? COVID Recovery, Congressional Leadership Perspectives. So much of what happens in the United States depends on cooperation between the Congress and the president. And the times in which we live put those two actors in sharp relief. Will the next COVID recovery bill again favor corporations over ordinary Americans? Will public policy be based on science, or will it be based on profits? And how will we protect the integrity of our elections that are coming up in just a few months to ensure that everyone participates and that no vote goes uncounted? The National Urban League puts these questions and more to congressional leaders. We're proud to offer today remarks from some of the most important leaders on both sides of the aisle on Capitol Hill. We will begin with remarks from United States Senator Chuck Schumer, representing the Empire State, New York. Senator?
Hi, everybody. This is Senator Chuck Schumer, and I wanted to start by thanking everyone at the Urban League for all the work you've done over the years, fighting for equality and justice for everyone in America. This is a difficult moment for our nation. Days after the death of George Floyd, we still are reeling. So too are we reeling over the memory of Ahmaud Arbery, Michael Brown, Breonna Taylor, and Eric Garner, and all the innocent lives that were taken in similar circumstances. The racial disparities in our criminal justice system have been on full display. But these disparities also exist in our healthcare and housing, in income and in wealth, in the boardroom and at the ballot box, on our streets and in our schools. For months, we have seen racial disparities play out in the pandemic. COVID-19 continues to infect and kill African Americans at a disproportionate rate. And the disease has put a magnifying glass on the structural inequalities that exist in America. We have to make progress on all of these issues right now, not later, not next year, not after the next George Floyd, but right now. As the Senate returns to session, we have a lot of unfinished work to do to fight back against COVID-19 and the economic devastation it's caused so many people, especially people of color. I was proud to fight for recent improvements to COVID, to reduce the disparities exacerbated by this disease. I work with my colleagues to make sure that PPP helped all small businesses, not those with the right connections, to make sure we improve our emergency funding for Medicaid, to make sure medical equipment reached underserved hospitals, and we increased funding for SNAP benefits to make sure families who normally rely on schools for meals have the means to provide for their families. But we still need additional COVID legislation to provide hazard pay for essential workers, to strengthen unemployment benefits, and to help our small businesses and nonprofits. I work very hard to see that Black-owned businesses and our churches and other houses of worship who are essential to local economies get the help that they've needed during this crisis. They were not going to put in money for nonprofits or for churches, but we fought hard along with Mark Morial, your leader, and we won. And we need to support our underfunded hospitals and make sure that all people have access to the care they need. But we cannot wait until after this pandemic to continue our fight for justice. Amidst a once-in-a-generation challenge, we've been reminded of a generations-long struggle for racial equality, for justice. Senate Democrats will be discussing what action Congress can take at this moment, and many of my colleagues will prepare legislation. We will listen to our allies and our constituents who face these challenges on a daily basis. We have just succeeded in one other area, setting aside $10 billion for community financial development institutions, and we're making the same fight now for minority development institutions, so that small business people of color will be able to get the same loans as everybody else and keep their business going. We'll be able to get the same grants and the same help as well. So we can, by working together, create some bold programs that actually are enacted into law. I want to thank again Mark and the Urban League. We've been together side by side to achieve these changes, but we have a long way to go. I pledge to stand by your side and work with you every day so we can fight injustice and make sure every American has a chance to succeed in life. It won't be easy, but I will stand with you every day until you succeed. Thank you for your work, and stay safe wherever you may all be.
I'd now like to welcome remarks from United States Senator and Democratic Whip Dick Durbin of Illinois.
Hello to everybody attending the National Urban League's 17th Annual Legislative Policy Conference. I'd like to thank you for inviting me to discuss an important issue that really has come front and center in the last several months, the racial disparities in our healthcare system. A good friend of mine who's a state representative, Cam Buckner, used to be on my staff, said something recently, and I've quoted him many times. He said, "This pandemic is not going to break us, but it's going to teach us what is broken in America." Amidst all of this pandemic, there's an alarming trend that's come to light. Like so many illnesses and conditions, the coronavirus is disproportionately affecting minority communities, African Americans, and Hispanics. In Illinois, black residents make up less than 15% of the population, but account for 32% of the coronavirus deaths. And Latino Illinoisans, who represent 17% of the population, 27% of the confirmed cases, the most cases of any race or ethnicity. These numbers are a sobering reminder of the historic inequalities in our healthcare system and economy. Black and Latino Americans are less likely to have health insurance than white Americans and more likely to have chronic diseases, which makes the chance of serious illness or death even greater for coronavirus. One of the major hospitals in Chicago told me that of the people dying from coronavirus in their hospital, half of them had no insurance. How do you reach a point where you have no insurance in America? Poverty takes you there, and bad circumstances take you there, and we've got to put an end to it. Furthermore, Black and Latino Americans are more likely to hold essential frontline jobs, increasing the risk that they're going to contract coronavirus when they go to work. All of these factors, including exposure to trauma, racism, nutritional access, have been magnified by this pandemic. And shame on America if we don't come out of this determined to put an end to it. It's long past time we do more to address this problem. It means improved access to affordable health care, increased funding for schools, and I might add funding to make sure that we have more people of color who are doctors and nurses and in medical professions. We need to address environmental injustice, increase the number of healthcare providers in underserved areas. I have a bill called Health Heroes 2020 that does just that. Many organizations like the Urban League have worked to advocate for causes important to Black Americans and other minority communities for decades. We need you now more than ever. Thanks for all you've done, but the biggest work, the most important work is still ahead of us. Doing it together, we can get results.
Next, we welcome remarks from House Majority Leader, Congressman Steny Hoyer of the 5th District of Maryland.
Hello. I want to thank President Morial and the National Urban League leadership for inviting me to join you for your virtual conference. I've been honored to speak at the National Urban League's annual gatherings on Capitol Hill in past years. Though I know the circumstances are not quite the same this time, it is nonetheless a great honor to be a part of this year's meeting. As our nation confronts its greatest public health crisis in the century, it is easy to forget that the National Urban League and its allied civil rights and anti-poverty organizations have been combating an ongoing series of public health challenges that continue to affect the most vulnerable communities in our country. These include hunger and malnutrition, uneven access to quality basic health care, disproportionately higher rates of heart disease, chronic lung disease, diabetes, and other ailments, as well as the persistent and tragic public health threat of gun violence. You are no strangers to the arena of public health challenges. And when we finally do get the COVID-19 pandemic under control, which we eventually will, through the hard work of our frontline healthcare workers and the perseverance of all those helping by practicing social distancing, we will still be confronting these other challenges. It is my hope that Americans who care deeply about helping the most vulnerable in our country, not only those vulnerable to COVID-19, but vulnerable to hunger, homelessness, unequal access to health care and education, will draw strength from our common purpose in defeating this virus and apply that strength with renewed vigor to the causes for which we have been fighting for years. If we can find a way to produce a new vaccine and innovative treatments in record time, as I believe we will, surely we can find a way as a nation to ensure that no child in America goes hungry or lacks a proper education. That's what you're about. If we can bend the curve down in the fight against COVID-19, surely as a nation we can bend the arc of the moral universe toward justice just a little more every day, as you are doing. Surely we can get justice for men like George Floyd, whose death was a terrible tragedy and which demands justice, as you are doing. And if we can rally around the common purpose of eliminating this coronavirus, surely we can do so and eradicate the deadly virus of hatred, racism, and inequality that infects our society, as you are doing. That is my hope. I know it's yours for the aftermath of this pandemic. But first, we must defeat this virus. And to do so, we must recognize the serious racial disparities that exist. We know that infection rates, hospitalization rates, and fatality rates are higher for people in African American and Latino communities. But we don't have all the data we need to understand why that is and to ensure that resources are being allocated to hospitals and communities that need them most. That's why I've called for better collection of demographic data when recording COVID-19 cases. And I sent 2 letters in April and May to the National Governors Association asking that states, territories, and the District of Columbia take additional steps to record such information and share it with public health officials and policymakers. We need the facts. We need the science. We need to know how big the challenge is. We must collect this data if we are to know how best to protect those who are most vulnerable. At the same time, as Majority Leader, I will continue to make sure that the Democratic-led House is doing its job, working with you to help those affected by the economic impacts of COVID-19. Congress, as you know, has now enacted 4 bills to address the pandemic health and economic impacts, including putting money in the pockets of those who have lost their jobs and helping the most vulnerable stay in their homes, access free coronavirus testing, and get the nutrition assistance they need for their families. Building on the earlier legislation we enacted, the Democratic-led House earlier this month passed the HEROES Act to provide much-needed funding directly to states and localities, straight to the communities where people are hurting the most and where local authorities need the most help providing basic services. Your president, Mark Morial, has met with us, instructed us, and given us great advice and counsel. And we thank him for that, and we thank you for that. And the House stands ready to do whatever will be required to ensure that workers can keep getting their paychecks and that small businesses can stay afloat so that we'll be able to reopen when it's safe to do so. Friends, that day will come because of everything we are doing together to stop the spread and support our healthcare workers. I am confident that we will come out of this crisis and come out stronger as a nation than ever before. And I pray that be so. Stronger because we pursued a common purpose. Stronger because we embraced our shared humanity. And stronger because we recognize that there is little we cannot achieve if we commit the energy and resources to do so. That's what the Urban League is all about. That is what each of you are all about. When this crisis has passed, I am comforted knowing the National Urban League, that all of you will not rest but turn from this fight to the next, as you always have, and help rally our nation to tackle the inequalities, injustices, and public health challenges that we must address if we are to fulfill the promise of our founders. I look forward to continuing to join that fight with you. You keep the faith. I'll keep it with you. Thank you.
Last but certainly not least, we welcome House Republican Whip, Congressman Steve Scalise of the 1st District of Louisiana, and my college classmate. Congressman?
Hi, this is Congressman Steve Scalise. I want to thank the National Urban League and my friend Mark Morial for the invitation to address you today. I know normally we would do this in person, and I've always enjoyed seeing you when you come to DC and have your annual conventions, but obviously things are different today, and I want to talk a little bit about where we are with the coronavirus and especially how we can get back to the things we used to do, how we can rebuild the success we were seeing in our economy, where people had real opportunities and we're seeing such good success, and all of a sudden that came to a halt. And so one of the things I want to mention is what's happening in my city of New Orleans. And Mark knows this well from when he was mayor. New Orleans was challenged severely, like other states, like New York. The city of New Orleans saw such a big spike in deaths from coronavirus. We all worked together, and I'm very good friends with New Orleans' Mayor LaToya Cantrell. We worked on a number of things to help get more PPE, for example, to our doctors and nurses, to help up-ramp testing and make sure there were enough ventilators for people. But what we ultimately need to do is find a cure and a vaccine for this disease. We've seen the impact throughout our country, so many deaths, and even it's such a disparate impact on the African American community. And it shows why we need to put even more focus on finding a cure, doing the research. I am very encouraged by some of the things I'm seeing in the medical community. When you talk to some of these great drug companies who come up with so many life-saving drugs, they're working and researching and testing a number of things that are showing real promise. And so we're putting a lot more money at the federal level into that kind of research to find a cure and to find a vaccine as soon as we can, because we want people to be able to start getting back out. We want the barbershops to reopen. Even I need a haircut every now and then. And just to be able to see our friends again, to go to our local restaurant. In New Orleans, we love our restaurants. And we will socially distance. We're smart people. We know how to manage this disease as we're going through, and knowing that we got to be a lot more careful. But at the same time, we want to start getting back to our way of life and rebuilding. I mean, we saw such great success. Unemployment in the African American community was at its lowest level in the history of our country just a few months ago. We need to work to get back to that, to rebuild that opportunity, to create hope again. We saw it in New Orleans after Katrina. So many people pulled together, communities pulled together, and we got through that. And we rebuilt an even better city of New Orleans. We can do the same with our country, working together. Look, you know, on a sad but note that kind of shows us where our hope needs to be. We lost so many great people. Somebody who I got to be really good friends with, Ellis Marcellus, passed away, died because of coronavirus just a few weeks ago. Ellis was a great community leader. We all know his family so well, what he meant to people. And to lose somebody like that is such a tragedy. But what's even more sad was that we never got to really celebrate his life. In New Orleans, we have jazz funerals. There would have been one of the greatest jazz funerals for Ellis Marcellus, and that never got to happen. Maybe after this we can have a great jazz funeral to pay tribute, as we should, to somebody like Ellis Marcellus and so many other people that we lost through all of this. So again, I want to thank Mark and the National Urban League for the work that you do throughout our communities. With your support, with everybody pulling together, we're going to get through this like we've gotten through so many other challenges in our nation's history. Great being with you. Thanks for the invitation.
I'd like to thank the members of Congress for their thoughtful remarks and the bipartisan spirit in which it was delivered. I also want to thank all the members of Congress and leadership who could not be here today because of the crisis. We hope that you're working hard, delivering much needed relief for Americans in these trying times. Thank you again, and we hope you enjoy the next session.
Good morning. I'm Tamika D. Mallory, and I am so excited to be here for a robust conversation with the Urban League and a panel full of some incredible minds. This session details how the Urban League and its community partners are fighting to reclaim your vote. Let's learn together about aggressive community-based voter education and registration efforts underway and how activists are working at the local and national levels to ensure the integrity and accessibility of voting options, from early voting to mail-in ballots to safe distancing at the polls. Community engagement is reclaiming the vote for millions of Americans. Find out what you can do, what we can do together to build momentum for November. I have an incredible group of people that are joining me for this discussion today, and I have to admit that I just want to listen and hear from them, because we have to go from the streets to the ballot box. We have to go from the streets to the legislative process, or else the marching and the protesting won't mean a thing. So today we're going to be talking about what you and I can do. We're joined this morning by Judith Brown Dianis, the executive director of the Advancement Project, and someone that I listen to regularly, and then I go out and steal her talking points and say them as if they were my own.
In America, we don't steal, we appropriate.
Well, appropriate then. And that is my brother, David Johns, who is the executive director of the National Black Justice Coalition. And last but not least, Janae Nelson, the Associate Director Counsel of the NAACP Legal Defense and Educational Fund. Welcome, y'all. Let's get into it. So there's a lot happening. The streets are loaded. People are out there. Folks are not asking. They're not begging anymore. They're not crying about it. They are demanding that there be justice. And I think the time is overdue. The list is too long. There's too many people. And, you know, I was saying today, I was thinking that there's something about listening to George Floyd call for his mother that I think has transformed the hearts and minds of many, many Americans and people across the world, because folks are marching everywhere. People are organizing everywhere. But I think it will all be for naught if we do not ensure that our people are educated properly and prepared to go to the polls. So I think this is a very important moment and an important conversation. And I'm just going to throw it out there and just ask, how are y'all feeling? Like, how are you feeling? And particularly to you, David, as a Black man, how are you feeling right now? And how does your work intersect with this moment?
I appreciate that. In this moment, I'm honored to share a space with each of you, three brilliant, beautiful Black women who long before cameras have been in your faces have been committed to doing the work required to ensure that all of our communities can just be safely without fear of discrimination or threat of violence. And so while I am weary and what it feels like to watch so many people appreciate that they can no longer deny, hide, ignore, otherwise try and eschew the reality that we have two different applications of systems in this country, makes me weary, again, because we've been doing this for a long time. But I'm also encouraged because this is about appreciating that this is about a movement, right? And these moments matter, they're meaningful, but this is about a protracted struggle for equity, right? For justice for us. And so that having been said, there are three things that that our organization is especially mindful of, and then I'll make way for the experts to talk, because I want to listen as well. One is focusing down ballot, right? We spend a lot of time, especially in presidential years, talking about the president and what's at the top of the ticket. What I know based on our work with community-based organizations throughout this country, in particular those that do work to support Black LGBTQIA+ communities, is that the action really is focusing on district attorneys who have a lot to do and a lot to say in these public moments where lives are taken by thugs who wear uniforms. And so focusing there, we spend a lot of time focusing on school boards, who was elected or otherwise appointed, or who gets to walk on and volunteer and control what it is that our students experience in that system that also has been designed and in many ways functions like the prison industrial complex or the medical industrial complex. And so focusing there so that we remind people that all elections are local and that it's important for you to be mindful of what's going on in your backyard is really important. Federally, we're supplementing a lot of the efforts of our colleagues at the NAACP, Urban League, Advancement Project, and elsewhere by ensuring that if people are able to show up and or otherwise mail in their ballot, that they can trust that there's some integrity around the process. It's too often that we tell people just go vote and not really hear when they say, but I don't trust that my vote is actually going to be counted. Not that it won't count, but that it will not literally be counted. And so ensuring that there are measures that include safety for poll workers, but also training for poll workers. I had today a deputy director of the initiative I led under my still President Barack Hussein Obama, who went to go vote in Indiana. And she had a poll worker who practiced a form of suppression that is gonna be familiar to many. And essentially what Lauren shared is that I went to go vote and the woman checked my ID, said she was excited because I had a new ID. She held it up and exclaimed, wow, it looks like a real criminal mugshot. It's not very pretty, but I can sure tell it's you even with your mask on. She giggled, then showed her friend, and Lauren writes, I held back my tears. And so I say this to say again, like most of us are often in these moments thinking about how white supremacy shows up as white boys behind sheets, but we should be mindful of the ways in which people practice insidious forms of voter intimidation, including when people actually show up to cast their ballot. The last thing in this moment that I'm really mindful of is that words matter. Even us having this conversation, talking about justice feels wrong, right? It is a problem in this country that justice means white people get to weaponize the police and call us to make sure that they and their dogs are protected even when they're doing something wrong. And it is sad that we have accepted that in America, justice for Black folks means that we can be killed. And at best, we can hope that our killer will be arrested. And so we have to be mindful of the fact that words matter and that there's power and precision, and change terms so that justice actually looks like ensuring that not only is that person arrested, but that they are charged and that they are decertified so that they cannot get another job at another precinct in another state, and so their family cannot also receive a pension. It's that kind of meaningful and lasting change that will allow us to not have to come to this place again where there are literal fires in communities because our country has been burning for decades.
The panel's over. Thank you very much, Dave.
He said it all.
Appreciate it. You said a mouthful. Breonna Taylor, we've been talking about George Floyd, and again, I believe that George Floyd is a martyr because he is going to actually change the world. Like, I see that. I truly believe that. And we often run to our men, Judith and Janae. We run to them. We organize for them. We get ready for them. We take their name to the ballot box. We're like, I'm voting today to change the law for Sean Bell, for Tamir Rice, for Mike Brown. We call the names. But when it comes to our women, whether they be Black trans women or just women in general, we do not have the same energy. That's just a fact. We see that playing out right now with Breonna Taylor. We know folks want to run for Ahmaud Arbery, and they should. People are flooding the streets for George Floyd, and they should. But when it comes to Breonna Taylor, it seems like the movement is a little bit, it's not as loud, and that she has to be sort of like a tail end thing with the rest of these conversations. But as women, we know that she is not alone. She was in her home. She was shot 8 times with 30 bullets flying around in a building. Officers were shooting at her from the outside of the apartment with the blinds closed, y'all. I went there. I saw bullets in the window around her sister's window. Her sister was out of town. If she had been home, the bullets were in her dresser, her bed, the walls. If she was home at 12:30 at night, she might have been in her bed and the mother, Tamika Palmer, would have been burying 2 people. But when I look at the elected officials that they have in that town, I don't think they have anyone Black at all. I don't think so. It may be 1 or 2, but it certainly wasn't significant at all. And what do we do in this moment, given the breadth of the complexity of all of our challenges? How do we use the fact that we as women are pissed off about Breonna Taylor and all the other women that we've lost, and we want to do something meaningful? How do we activate ourselves and take her energy with us to the polls and to organize our people? I'll start with you, Janae, and then of course, Judith, go on and preach for us and take us home.
Yeah, I really appreciate the question, Tamika. And I will say this, it's true. We know that women face discrimination in all aspects of life. And we know that their pleas and their concerns are always marginalized when it comes to comparing the needs and wants of men. That's a given. And that's another ism that we need to fight to destroy. That's another a form of hierarchy and patriarchy that the Black community must acknowledge and must recognize, that we have to dismantle that discrimination against women if we want to free ourselves as a people, all of us, men, women, trans, anyone. But I do want to say this, it's not just us acting alone. The media doesn't lift up the stories of Black women in the same way that they do Black men. So I don't want us to take the entire onus and suggest that we don't care. It's Black people and Black women who are trying to shine a light on the women in this struggle who have lost their lives at the hands of police, on the women who have been disappeared, on the women who routinely suffered abuse at the hands of police. So I want to say that, we have a responsibility, of course, and we can always be doing better, but we also must demand more of media. And if they aren't going to deliver that visibility that is required for women, Black women's humanity, then we need to create those media outlets on our own. And many of us are trying to do that. We're trying to lift up our own stories. We're trying to make sure that every time we mention George Floyd's name, we also mention Breonna Taylor. We're trying to make sure that we don't forget Sandra Bland. We're trying to make sure that we don't forget Corinne and all the other names that we could go on and on and on listing. You hear Say Her Name. That is a hashtag that created by Kimberly Crenshaw has really taken off and constantly reminds us that we have to say Black women's names if we expect to get any justice for them ever. But there's just so much that needs to be done to think about how we not only bring some visibility to Black women and their struggles with law enforcement, but also to use this moment to make sure that we come out on the other side. And you said that you feel hopeful. And I have to say, I feel hopeful too, but I also feel an enormous responsibility. There are people laying their lives on the line. There are young people out in this street because they believe that it is worth it, that whether they risk COVID, whether they death by bullet or assault, whether they risk getting arrested and thrown in a jail where it's basically a petri dish at this moment, they're willing to do all that. And you've got to ask yourself, why would you be willing to do that if you didn't believe that your life was worth it and it is worth fighting for some transformation, not just change, not just reform, but transformation of how we think about law enforcement in this country.
Judith?
So first, Tamika, I wanna thank you for always being on the front lines, like literally. That's where you probably just came from, being on the front lines. And when I think about Breonna Taylor, having been in this work for a little longer than you youngins, I have seen a change, and that change has been that our movement, the civil rights movement and racial justice movement, really had there was a stronghold by men in our movement. It didn't make way for sisters. And I'm of the age of that like bridge where brothers were still holding on so that there couldn't be space for women. And I think that is part of the reason why we sometimes don't lift up our sisters still. And that I am hopeful that that is changing, because I see so many young women leaders stepping up and being the people on the front lines. When you look at so many of these photos from across the country, it's Black women putting their bodies on the line, right? For brothers and for sisters. So I think that that is going to change. It's still taking some time, right? I think Breonna Taylor, I think the other thing is the video, right?
Mhm.
Video versus not video. But we have to tell her story, just like Sandra Bland's story, Tatiana. There's so many sisters who have lost their lives, and we all have a responsibility to tell that story. And I think for Black women, we play such an important role when it comes to power building, right? Republican, Democratic Party, they're concerned about Black women because they know that we don't play around. We vote and we bring our families with us. And that, in fact, we are the ones that they have to watch, and they have to be thinking about, what do Black women care about in the moment? And so we have some opportunities for Black women to keep stepping up. As Janae said, we've got to create our own space, right? Like, don't wait for anybody to create it. We're going to create it on our own. That's why friends of mine and I, we started a Facebook Live show called The Sip, because we wanted to have a space for Black women voters to come together to be assessing the moment and thinking about the politics. And so I think as we move towards November, it's going to be really important for us to scrutinize any candidates that are put up. Whether it's a Black woman or a white woman by the Democratic Party, we have to scrutinize what they're saying. Are they going to take care of our families? Are they going to do what's right by us? And to David's point about down ballot, it is so important. We're in the streets, but really being in the streets is about power. We have to organize, we have to protest, and we have to vote. And so there are races down ballot, sheriff's races. We're working on Advancing Project, we're working on sheriff's races in Georgia. There's over 150 sheriffs that are up for election in November. Sheriffs, law enforcement, we can actually have power over this, right? In Florida, there's 66 of them that are up for election in November. And so it's not just about the top of the ticket, but it's where the power is on the ground that we have the ability to influence, and that we have to make sure that they understand that not only do Black lives matter, but Black lives are about to change this whole equation. And that, in fact, one of the things that just came over, I was watching online, that because of Black people putting their bodies in the streets, the Minneapolis school district, the Board of Education voted today to get rid of police in schools. And that is because they understand that those police should not be trusted around our children, because we don't trust them on the street. So I think, Tamika, that we have to step into our power, like we've been stepping out in the streets. November is going to be a time to step into that ballot booth and handle our business.
Tamika, can I add one thing before you? I want to honor the responsibility of being the Black men feminists in this space, and say that up until and past November, it is a responsibility of Black men, both cis and trans, to alleviate the burden that our sisters almost always carry. It should not be the case that we honor that Black women always hold us down in the way that they do and expect them to do that. We need to carry some of this water. The other thing I want to honor, celebrating that, and this is to a point that Janai made, is that there's a lot for us to do that's by design, right? You, Tamika, earlier were searching for language, and I typed it in the box, right, to honor the space for women, both cis and trans.
And trans, right.
And I want to celebrate that I've watched you learn and practice that. That is not something that has come easy. And so a part of where we are, to Judith's point about the evolution and all of this, is appreciating that the process of fighting for the rights of all of us and making space for all of us is complicated by design. There's a lot of work to do, but we have to continue to work through it. Judith mentioned Florida. Florida is also the place, Tallahassee, just this past week, where Tony McDade a Black trans man was murdered by the police. No one is saying Tony's name, right? We still have work to do around our sister Breonna. No one is saying the name of Nina Pop, a Black trans woman also murdered in her home. No one has been called to account for that or atone for that, right? And so I say their names specifically because there are so many members of our community who still don't know, who still need to learn language around the identities and expressions and experiences of our trans brothers and sisters and non-gender conforming folks. But I also want us to all give ourselves grace because there's a lot of work to be done by design.
Yeah, and I appreciate you, David. I mean, you know, I don't take offense to it at all. I know what I don't know, but I also know that I want to learn, you know, that I'm begging for the patience with my learning process, and I'm growing, trying to make sure that my language and I make mistakes, of course, all the time, but that my language and my intention is inclusive of all Black people, because that is something that I think we are challenged with, that and when we say, well, why don't we, you know, talk about Black women or Black trans women or this and that, everyone doesn't even feel like they're at the table. A lot of times we leave people out. So thank you for telling me it's cis and trans women. And I've heard that a million times and I still didn't grasp it. So thanks, because I'm gonna, you know, make sure that I do my job to remember. COVID-19, you know, I say to myself, so yesterday, the craziest thing happened to me. I was doing an interview on BET with Mark Lamont Hill and Senator Cory Booker. And in the running, the fray of everything I have going on, the interview had to be held outside of my mother's home because that's just what I had to do. And where she lives, so we're talking about police violence and law enforcement and criminal justice and protesting and everything. But at 7 o'clock, in the midst of doing this interview, people start clapping and music starts going, and the whole interview is being interrupted by all of these sounds. And so they're like, and Cory Booker has to go. So he didn't have time to like wait for everything to calm down. And I'm just sitting, so I said, so that they stopped it for a moment to say, hey, like, Tamika, what's going on? And I was like, you know what, just let's flow and I'm gonna talk about it. And I did. I said, we're living in a time when we're protesting and clapping for essential workers at the same time. Like, we're trying to honor our essential workers who are dealing literally with a virus that is killing our people. And we are also dealing with police violence that's literally killing our people. And we've got to be able to function in both spaces, unfortunately. So you might as well just roll the tape, because this is like the real live on the ground, what's happening in our society. And I was thinking like, damn, it's so much, because COVID-19 has people literally afraid to move. There are people who are bad protesters. They're bad organizers. They're out there. They do the work. When I say bad, I mean it in the best way. But they have not been on the front lines because they are afraid. They have pre-existing health conditions. They're just nervous anyway. They don't know what might happen. They're taking care of loved ones, and they just can't be in the movement. That scares me going towards November, y'all. That scares me going towards November. Sure. Knowing that we're in a moment where people have had to turn out in the streets like they haven't since probably Trayvon Martin and the Black Lives Matter movement, right? People are maybe Eric Garner. People are in the street.
Not like this.
Not like this. Not like this. Not like this. When I saw people marching on Martha's Vineyard, I was like, oh, wait a minute.
It's different. I never see that.
This is a whole different. And there's no Black people there right now because the season hasn't even started yet. So there are no Black people. So these were white folks moving around their grocery store saying Black Lives Matter in Martha's Vineyard. Okay. So you're right. Not like this. Not like this. And this moment that we're in, you know, I hope we're putting our lives in danger. Like, I'm telling you that I have been exposed because in the middle of these protests and stuff, I can't say that I don't have the mask on properly every minute. Sometimes it's hot. In Houston, Texas, and Minneapolis, it's burning hot and I'm trying to breathe. And then I might rub my eye and then I'm sweating. Right. And So we're putting our lives in danger in order to save lives.
Right.
How are people going to the polls in November?
Yeah. So I'm going to jump in on this. So this is a huge concern. And so the Florida primary, for example, was just around the time that the pandemic had been announced. And folks in Florida were like, well, we can't just act like business as usual, right? We ended up filing a lawsuit to the Friday before the Tuesday primary, just to get the extensions for asking for an absentee ballot and then returning an absentee ballot, because no one should have to choose between their health and their right to vote. And so it made total sense. We did not win. But what happened was the case is still around because now we're still fighting about their August state primary and then what the preparation is going to be for November. And so one of the things that we have to understand is that, in fact, I was looking at pictures today from North Carolina's primary, where people are standing in line. There's hundreds of people standing in line, and they are not socially distancing, and they're in North Carolina, and they are not wearing masks, because as America has reopened, people are forgetting that we are in a pandemic. And so as we move into November, what we have to know is that we need options around voting. The best thing for states to do is to do what my state of Maryland did for the primary. Everybody was sent an absentee ballot with the postage prepaid so that you could vote and send it back. You have drop-off boxes if you don't want to put it in the mail because you don't trust the mail, right? So you have that option. But also for people, because our community's used to showing up for voting. It's like a community thing. The churches do it, everybody. So how do we have spaces where people can be safe when they go? So there's curbside voting that we're advocating for. So if I could drive up, poll worker bring it out to the car so I can vote from the car. There's also drop-off boxes at places where I can drop off that absentee ballot. And for people who do want to stand in line, that we make sure that early voting is long enough so that we can spread out the people. Because we cannot continue to have people put themselves in danger. And at the same time, this, I hate to say it, we always say this election is the most important election of our life.
It always is.
This one is.
This
one is.
No, but this one is. This one is.
Yeah.
So take it seriously. So we can't opt out. That is not an option to opt out. We have to vote.
There's that, and I know that
That's right.
the theme of this is about community solutions, right? All of us are able to lead in part because we learned these lessons over time. One of the lessons that should be applied in this moment is taken from our work fighting against the HIV epidemic. And so NBJC is working in the months leading up to the November elections to ensure that as people are protesting strategically, that they're able to get tested. We have a history of doing that around HIV. There are a lot of organizations, especially Black women serving organizations, that are doing a much better job of that around mammograms and breast cancer and things that disproportionately affect Black women. We can take a lesson from that and offer COVID testing for folks that are also protesting, right? That's one thing to think about. And there's some innovative things happening. There's a mobile testing unit in San Francisco that allows people with housing insecurities to be tested, to take a shower, and to get access to information so that they can otherwise be engaged in the ways in which they need to be. The other thing that I'll say that's really important for us has been collecting data about people's experiences. So we launched a survey tool called COVID While Black and Queer, because a lot of existing data sets don't collect information that allows us to talk about us in our own language, right? And we know that there's data that talks about disproportionate impact for Black folks. There's separate data sets for queer people, but there's nothing in the middle. And so over the coming months after June 19th, the data will be released because that day is important to us. But we will leverage these storytelling opportunities to also give information to municipal leaders so that they can be ensuring that whatever, if it's a mail-in process or a process of people showing up, that they're accounting for the needs of people and designing opportunities for people to vote.
Yeah, let me just jump in and say that repeat something that some of our allies here who are part of this Reclaim the Vote campaign have talked about. And it is, we are going to vote, whether it's by mask, by mail, by any means necessary, we are going to vote this November. And I feel so much more heartened because of the protests that people are willing to do what it takes to vote. Hopefully they will not have to risk their health. And in fact, no one should ever have to risk their health and weigh the right to vote and the right to, personal safety. And what we need, as Judy said, is we need options. We need to make sure that we can vote by mail, that we can get registered early, that there are opportunities through early voting to vote for longer periods of time so that we can space ourselves out. We must demand that of our elected officials and ensure that there's enough machines so that everyone's not crowded around the same machine. And all of this needs to be happening right now. We're preparing for November now. And our campaign at the Legal Defense Fund is prepared to vote. You must be prepared to vote. This is not something you can wait until the last minute to do. This is not something you can wake up on election day and decide, okay, I'm fed up, I'm gonna go. No, you need to, one, find out if you're registered. Even if you've been voting every day for the past 10, 20 years, you need to wake up again and say, am I registered to vote, and to check that verification. And then make sure that when you go to the polls, you have whatever requirements your state demands of you. We are fighting against draconian voter ID laws and other forms of suppression. But at the end of the day, come November, have your paperwork ready. Have your papers in order, have everything you need, and be prepared to vote. And there are many resources. Each of our organizations, I'm sure, I know ours does, we have resources for all of the states in the South that have high Black populations, and to make sure that people know the ins and outs of their local voting rules to enable them to cast a ballot and have it counted.
Well, it's funny because you said we're going to vote regardless. Doesn't matter what happens. And in Wisconsin, in a special election, there were headlines about people, and we were right in the eye of the COVID storm, and people were there. They went to vote. And I think that the goal at that time of the government was to try to keep people from going to vote. And because obviously I don't think they believed that people would show up in the ways that they did and stand on lines and really be so determined. I hope that translates. I want, we have to make sure that it translates.
But this is after the Supreme Court. This is after the Supreme Court shortened the absentee ballot period. So people were counting on staying home. They felt that they could stay home, but they actually turned out. So that to me is encouraging.
That's a good sign.
Yeah, that's a good sign.
But we should also be mindful of the implications, right? So all of this is about pain, right? Black people having to endure pain to force this country to live up to its founding. Even in this moment, right, Tamika, I'm worried about your health. It is important to all of us that you were able to do what you do in the world, but if you're not healthy, you cannot do it, right? And so as we are thinking about the risk that people are literally offering themselves up to, putting their bodies on the line to demonstrate, we should be mindful of the cost.
Absolutely.
Yeah. Susan Taylor, she hit me up and said, hey, I want you, we love the great Susan Taylor. She says, I want to talk to you about oregano drops. And she said, and I'm like, I take oregano shots every day. And she's like, well, there you go. Like, yeah, we learn some things and try to take care of ourselves. I'm doing the best that I can with the CMOS and all the things that I need, but rest is really important. And I think that's something that we all are challenged with, is getting the appropriate rest for this fight. And I know for sure, because when I'm on Facebook, I look at all of y'all's pages and I see the little green light on at 3 o'clock in the morning, which means that none of us are sleeping through this pandemic. We're all up. The little green light is on.
Yeah, who can sleep?
But you can't. So we can deal with COVID. We can get people to the polls. We can do absentee voting, but you can't account for cheating. And they are going to cheat. They cheated. They cheated, and they continue to cheat. That's a part of the process. People keep saying, well, Donald Trump won the election. No, Russia won the election for Donald Trump, right? So how do we deal with that, y'all? We got to talk about what, because we need people to show up like they never showed up before.
Yeah, I mean, so the thing is, cheating, they cheat because if you can't win, change the rules. That's the way that's their playbook, right? And so I think this means that we have to be educated, right? Because even the vote by mail, there are some tricks around vote by mail, right? That can lead to your vote being thrown out. And so it's really important that we get to know what the process is around vote by mail. For the cheating thing, you know, there's lawyers out there like us at Advancement Project and the Legal Defense Fund and others who are, we're gonna be suing a hell of a lot this year in order to make sure that they don't put up more barriers. Because the other, you know, it's not just the vote by mail stuff, but the closing of polling places is a serious concern, because the use of the fact that we are in a pandemic and so some people are going to vote by mail, so that means they can have fewer polling places. That's a problem, because if I now have to travel 5 miles, 10 miles, 20 miles to a polling place, that's one polling place for a whole county, that is a problem. And we know that what they do is they often do that because they know who ain't gonna travel that far, right? If you think about people, Native American folks who have to travel 30 and 40 miles to get to a polling place, that people they do this to dissuade us, right? And to make it harder, because they know the harder they make it, then maybe we'll give up. Number one, we can't give up. Number two, we're gonna sue their pants off, right? And we'll continue to do that fight. But we definitely have to be educated about the process so that it's a little bit smoother sailing for us.
And we're smart, right? To your point, Tamika, we know the games that they've already run out of that playbook. And at this point, a lot of our organizations are working in partnership to leverage the data that already exists, to be able to get in front of misinformation, to be able to correct for a lot of the suppression campaigns that have actually been working, and to otherwise better organize, right? And so to Judith's point, there are things that we already know and can anticipate, and we're trying to be more strategic about acknowledging that and interrupting it on the front end.
But you said, Janae, and I think it's such a powerful point, it can't be like last minute. And we have a tendency to do that. And the other thing, I'm just throwing something out there, you know, you all can say I'm wrong, but we've got to have conversation with foundations and labor and all the folks who have the money, that there has to be an investment in our communities in a big way. Because you talked, Judith, about how Black women, we lead the charge, but yet and still we are always behind the 8 ball because of the resources that our communities do not receive when it comes time to get our people organized. If we're going to get people to the polls, we're going to need folks to fund the movements on the ground. And that's been a big problem.
I think to your point, that is right. And that philanthropy has to understand that you got to stop funding in a transactional way. Just because you want us to turn out for the vote, that's one day of power, right? If we really want change in this country, that we're saying now, all these corporations coming out say, you know, they supporting, they're blacking out and all this kind of stuff, right? If you really want change, we have to know that this is 365, 24/7, and that we can't expect that let's just turn out people to vote and maybe everything will be all right, but that the organizing continues, the work continues. Right. The legislatures come in, and our people need to be ready to go to the legislatures to demand police accountability and all kinds of transformation. And so philanthropy's got to be thinking about, it's not just about this election. It's about the kind of world and the kind of America we want to build.
Wow. I mean, y'all know what to do. So we need like a school until the election. It needs to be like a school every single night online, teachings on the corner about how we're going to get to where we got to go. Because you talked about these sheriff elections. And I can tell you right now, a lot of people don't even know they can vote for a sheriff. They have no idea.
Sheriffs, judges, prosecutors,
Everybody.
you name it. There are so many down ballot opportunities that can in many ways touch your life more directly than whoever's sitting in the White House. Obviously, we know that when the wrong person is in the White House, it can be disastrous. But the person who is deciding who gets charged, the person who is deciding about how resources are allocated, the person who is making all of those local decisions, who's on the school board, who's deciding whether police can be in your child's school or not, who's deciding through distance learning, whether food service is being distributed equitably across whatever area that is or not. Those decisions are made usually by people who have been elected in some way. So it's critical that we also look at those elections and that we have an agenda for the people who are representing us, that we don't just turn off the day after November 3rd and say, okay, we've done our job, we've cast our ballot. No, you then still have to hold folks to account. They have to earn your vote, not just on the day of the election, but every day that they continue to remain in office. They have to pay that debt of getting your vote.
Pay that debt. I think we can take that as your 1 minute closing, because that's it. They have to pay that debt. People need to stop telling us that we can't demand and ask questions of folks because we're scared of the boogeyman. Yeah, we want to deal with the boogeyman, but we also need to ensure that whoever we put our votes, money, time, and energy behind, that they are going to actually do something for our communities, and there's nothing wrong with that. So let's get the closing 1 minute wrap up from each of you, David and Judith. What do you have to say? This is the moment. Like, we've got to get people ready. Give us something.
David? Okay, I'll go. Rise up. This is our moment. This is our time. People are taken to the streets because we are fed up. We're done with this. Think long term and let's reimagine these systems, and let's lean into making the world that we want and the America we want. Voting is going to be part of it, but don't just stop there. The next day, keep working, because freedom does not come fast.
At all. I will end where I began, which is to say thank you. I mean it as a mama's boy, as an unapologetic Black feminist, as somebody who has benefited from the work that each of you has done. Directly hear me when I say thank you. My word, my call to action is for us to be gentle with ourselves. It is not lost on me that we are always those who put our bodies on the line, literally and figuratively. And the thing that keeps coming to me is, and all of us who fly or who have had the privilege of flying know that moment when we can recite what they're about to tell us, and in case of an emergency, put on our oxygen mask first. What I know is that that is difficult for us as people who have skin that's been kissed by the sun, who are connected to the diaspora, who understand the importance of linked fate. We sacrifice ourselves for everybody else. In this moment, I want us to not do that. I want us to be selfish. I want us to be gentle with ourselves, and I want us to remain committed to the things that have allowed us to sustain this movement heretofore.
I also want us to be counted. It's not just an election year, it's a census year. And we only get one shot every 10 years to be counted. And we can't do any of these things if we're not part of the population count.
Actually, that should be it. Take 5 minutes and go. If you have not completed your census, do that now.
Go do it right now. Yeah, right now. Like, as soon as you get off, just take a few moments. Take care of it. You can go online. It's really, really quick and really, really easy. Go and fill out the census. And I think on that note, thank you for bringing up those important points, Janae, because we don't want to walk away from here without giving people their charge, their orders. And I'm just grateful to have been able to moderate such an incredible discussion. There's much to be learned from all of you super, super dope people. Thank you very much. And thank you to the National Urban League for having us be a part of this incredible, incredible discussion.
Thank you for being on.
Thank you, Tamika. Thank all of you.
Tamika.
Thank you.
I'm Mark Morial, and I'm president and CEO of the National Urban League, the nation's largest historic civil rights and urban advocacy organization. And we're once again proud to bring you the National Urban League Legislative Policy Conference for the 17th year in a row. The 2020 census is of paramount importance to our nation, to Black America, and to everything when it comes to political representation and the distribution of economic dollars in this country. Make Black count. That's our rallying cry. That's the name of our initiative. And now for almost 2 years, the National Urban League has worked with a broad coalition of community-based leaders, faith leaders, elected officials, under the banner of the Black Census Roundtable, to prepare our communities, to hold our government accountable, to ensure that in the end, we have a complete count and an accurate count. The undercount of Black people has been occurring since day number one. At the founding of this country, the Constitution mandated that African Americans were counted as 3/5 of a person, but afforded 0/5 of any rights. That was to allow Southern states to count those people who were enslaved for the purposes of the number of seats in Congress that were going to be allocated to them. As times evolved and slavery fell and segregation and discrimination became the practice and the law of the land, the census continued to undercount our nation's African American communities. We've been determined that in 2020 to end the practice, the policy, and the results of an undercount. And in today's session, we want to talk about why and how the census is so crucial to our communities. What steps we've taken to try to ensure that this census is going to count all of us fully and completely. And what we as a community must do, both in holding the Census Bureau, which is an arm of the Department of Commerce, which is part of the government of the United States, accountable to ensure a full count, and what power we have to make sure that we are counted ourselves. So today's discussion, I'm so proud that we've got three of America's leading voices on the issue of the 2020 census. First, Jerry Green. Jerry is a longtime, now retired census executive. For the last almost 2 years, she has served as a senior advisor to me at the National Urban League, coordinating, orchestrating, and driving all of our census work. I'm so glad that Jerry is with us today. We also have Louisiana State Representative Ted James. Ted joins us from the House of Huey, the floor of the House of Representatives in Louisiana at the state capitol, which is I call it the House of Huey, because it's a state capitol built by Huey Long in the 1930s. A capitol building I know so well. Thank you, Ted, for indeed joining us. And our third panelist is Nada Jumphy. She's the executive director of the Black Alliance for Just Immigration. Black immigrants, people who are from the Caribbean and from Africa, from South America, and for other parts of what we call the African diaspora, have been a very important part of the growth of the Black population in the United States, particularly in the 21st century. It's part of our goal and our responsibility to ensure that they are fully and completely counted, because they are part of our community and make up an essential component of our work to ensure fair representation. So I'm so glad to have all three of these great experts with us today, and I want to welcome all of you. And I first want to go to Jerry Green. Jerry and I have worked together all the way back to 2010, when I had the pleasure of serving as the chair of the National Census Advisory Council as an appointee of President Obama, and then Commerce Secretary Gary Locke. Jerry's joined us and brought an incredible degree of expertise to our work on the advocacy side, of understanding the mechanics of the census and what we can do to ensure. Jerry, set this up by talking about the undercounts we've experienced in the past, what the focus has been, and why we think this should be, and how we think this can be rectified with the 2020 census.
Oh, well, Mark, you know, as you mentioned earlier, the very first census in 1790 counted us as fractional people. And even then there was dispute. Thomas Jefferson and George Washington had it out because Washington expected a higher count of the American population. So from the very beginnings of this republic, or, you know, when this country was, I don't know, you pick the word, when the Europeans came and decided they were going to organize and do all these things to this country, there was a dispute about the census. And I should say that the census, the calling for the census, the enumeration aspect is right up there with the right to bear arms and freedom of speech. It's that important that it was embedded into the Constitution, right up there with those values that the Constitution holds dear. The undercount is important to our community because that's where power rests. That's where economic stability and growth rests with those census numbers. Those census numbers, the census count is the denominator for almost each statistical indicator for life in the United States. So if we're not counted, we miss out on those benefits of representation. The Electoral College is based on the number of seats, is based on the census count. The number of the population in each state, how many of those seats go to the Electoral College. More than $1.2 trillion in federal funds and programs is allocated based on the census count. So as we come out and emerge out of this COVID-19 experience, we're going to need those funds. We're going to have to rebuild our communities. And most of those funds that are going to be directed to our communities is based on the census count. So it is imperative.
And I want to thank you for the historic sense. And one thing I would note is the numbers in the undercount. Like, I understand that 3.7 million African Americans were completely omitted from the 2010 census against a total count of some 40 million. That's almost 10%. How can the Census Bureau miss 10% of the population?
That is true. And the Census Bureau will not tell you that 3.7 million Black people were omitted from the census. In addition to that 3.7 million Black people who were completely missed in the census, 7 out of 10 young Black children between the ages of 0 and 4 were missed in the census. You know, it's methodology, it's outreach. In fact, back in 1970, your predecessor, Whitney Young Jr., the great Whitney Young Jr., established, this is where we get the Make Black Count rallying logo from. He indicated that back in 1960, there was an undercount of the Black population by about 9%. So that's almost 1 out of every 10 Black people were missed in the 1960 census. And it's about how the Census Bureau allocates money for outreach, the methodologies for counting Black people. You know, are they using the best methodologies to reach our community? And it's also about our own population, not knowing and understanding the importance of the census to our community, you know? And so it's imperative that the Census Bureau and our organizations work hard, and we're doing this every day, to get the word out about how important this is. And now more than ever, the census count is important.
Ted James, for you, you represent the city of Baton Rouge. You're a state legislator. Why is the census important to you and your constituents and the state of Louisiana?
You know, I'll tell you first, let me apologize, guys, because I'm here on the House floor and several of my colleagues don't respect us enough to wear masks, so I'm keeping mine on while I'm not talking. But, you know, for us, you know, Mark, you know, because you're from Louisiana, one thing about the census, we know that the dollars doesn't follow the need, the dollars follows the number. And for us, with all of the needs that we have from infrastructure, with flood protection, you know, what we need to do to protect our young people, what we recognized here with COVID-19 is that we had major underfunding with COVID-19. So those fundings that are coming down for certain information regarding healthcare, we need those dollars right now, because we would not have had to rely on the federal government to send us tests when the city of New Orleans had more tests, more positive cases per capita than any other place in the world, had we had those dollars here. So it's very important that we continue to fight for every single dollar, because again, and I think I learned this from Jerry during the policy conference last summer, that the dollars won't follow the need like we know we have in Louisiana. It follows the number and count.
Well, that's so important. And Louisiana is a state that historically has had a population of about 30+% African American. It's also a state with a high level of poverty. It's important to document. It's important to fully count these communities and to understand the challenges that the great state faces when it comes to infrastructure and childcare and education and flood protection across the board. And Nana, the Black immigrant community, I think, is misunderstood by many who don't understand its magnitude, its size, and its contributions. Could you talk to us a little bit about, paint a picture of the Black immigrant community in America today?
Thank you so very much. And I want to thank you. I want to thank the National Urban League for inviting me to be a part of this legislative policy conference. And I'm so thrilled to be on this panel with our leader and teacher, Jerry Green, as well as with Representative Ted James. I bring you greetings from Baji. We are the largest human rights, immigrant rights, racial justice, Black-led organization in the United States. And just for scale, we organize, educate, and advocate for the over 10 million Black immigrants, refugees, and their families in this country. So that's the first piece that I always want people to hear.
10 million is the number we should remember.
10 million is the number we should remember. So that's my father, who is foreign born. That's me, who was born here, but like a Toyota made in Kansas. And then it's my son, right, born of me, and my husband. And so when you look at who we are, we're from the continent of Africa. African immigrants are the largest growing population of immigrants in this country in terms of who's coming here, right? And that's important for us to know. It's not often spoken of. If you asked anyone in the street who's the largest, they would not tell you folks coming from Africa, but that is the fastest growing group right now coming into the country. We also are here from the Caribbean. The Caribbean has a very old tradition of being in the United States. When you think Harlem Renaissance, when you think Marcus Garvey, right, you gotta think about the Caribbean. Malcolm's mother.
Claude McKay.
Yeah, hey, you know, all these folks are Caribbean related. So that relationship between African immigrants and Caribbean immigrants is an old one. We also have immigrants that are coming in from Europe, right? We got the Black Brits and we have the Black French folks, Black folks from Canada. Black people are all over the world. We're in Asia, we're everywhere. And wherever Black people are, they are coming to the United States and should be and will be, if we have anything to do with it, a part of this census count. When we look at our spread, we are mainly in urban areas, but you also find us in rural areas. And so when you see what's happening now with COVID-19 in the meat and poultry plants, in the factories, even farm workers in places like Georgia, Arkansas, Florida, you find the Black immigrant population. And then, you know, right up to the halls of Congress, right? Whether you're talking about Representative Omar, Negesi, you know, Horsford, Clark, you see that Black immigrants are also represented there.
You know, it's so interesting, I think, when we look at the Black immigrant community, what specific challenges are there in ensuring a full and complete count of Black immigrants? What will you think are the challenges we face? And then obviously, how can we overcome them? What's Baji's perspective?
So we talk about not being hard to count, but actually being hard to colonize. And I think that the same can be said of African American community. We have our communities. We love to be in our communities. We're not isolated, right? We go to work and we do other things sometimes outside of our communities, but we have our own culture, thankfully, gratefully, and we are connected to that culture. And so that's one of the issues, is that the Census Bureau, the government that is not really putting itself in our spaces. They're not, that's the cultural competency piece, right? That's not there. So they're not connected with what we're doing culturally that they can then use to introduce the census and give us the information. That's also connected to language access. The census has a directory that has 59 languages. It, of course, is missing a lot of African languages. But most importantly, if you want to take the census, the only Black language that you can take the census in is Haitian Creole.
Wow.
You have people that speak Amharic, never colonized Ethiopia. You have people that speak Somali. You have people that speak Wolof, Fulani, Tree, Yoruba, Hausa. And not all of these people went through a school system in their home countries, even if they were colonized, in which they were picking up now English as a language to speak. And so we've addressed that issue by making sure that we're in these places where we know our community members are, that we're reaching out to them, even digitally, where they listen to the radio, where they are looking at the newspapers, digital newspapers as well as physical newspapers. We're doing our own webinars, our own meetings, our Afrobeat, soca, reggae, DJ, census parties, right? Very pleased with the work that our
Are you confident that the message is getting through? Are you confident, and are there barriers? There was the old proposed citizenship test. There's lots of concerns about the use of the information. Is your message getting through?
It is getting through. I mean, when people hear about the census and know what it's about, we want good schools. We want health care. We want access to infrastructure. So people want to be engaged. There is a fear factor. And I think there we sort of share with our African-American cousins a concern about the government and what the government will do with this information. Baji was a plaintiff in the successful lawsuit to get the citizenship question off of the census. But those questions are still lingering. We know that the Republican Party sent out some fake census documents and had the citizenship question on there, which brought that issue back up again. But we're reminding our people that we are resilient, that as Black people, every time we walk out the door, that we know that we have the possibility of something going left in terms of our safety. But we also know that we protect each other, that we look out for each other, and we've let our community members know that we've got us. And then, lastly, really focusing on making sure that Black immigrants check Black, right? That they respond to that racial identity question as being Black, because we experience Blackness, good and bad, in this country together, and then putting where they come from. So when we did the census here in this household, in the Jumphy house, we checked Black, and then we put Ghanaian, so that we make sure that we have that information there, so that we can make sure that we get the access to the representation and resources that we know we deserve.
Well, I want to really thank you and Baji. I learned about Baji by reading the Los Angeles Sentinel several years ago. And the reason why it caught my eye, and I immediately reached out and hunted down, I believe, your predecessor, Opal Tometi, after reading an article in the Los Angeles Sentinel, great Black newspaper from Los Angeles, is because in some of the discussions we were having in the Obama years, there was nobody at the table representing Black immigrants. And civil rights leaders were sort of tasked with carrying the ball for Black immigrants. But it was clear to me that we were not fully knowledgeable. We were not completely, if you will, immersed in the challenges and in the needs of the Black immigrant community. So your Baji's involvement in the work of the census and in the work on so many issues has really been welcome. I compliment it, and I really, really thank you, because I think it's an important voice at the table in our community. Now, Jerry Green, COVID-19 has interrupted, has disrupted, has created confusion everywhere. How has it affected the census? One, what steps has the Census Bureau taken, and have the steps that the Census Bureau has taken been enough from a Black leadership and a Black Census Roundtable perspective to ensure a full count?
Okay, very well. So right now we're about in week 10 of the census. Back in March 12th, on March 12th, the Census Bureau began sending out letters of invitation to tens of millions of households across the country, asking people to participate in the census. A week later, the pandemic hit and it rocked our world, including the constitutionally mandated census count. Since that time, the Urban League and other civil rights organizations have taken tremendous steps to protect the Black count. So to your credit, Mark, as soon as the National Urban League saw this pandemic spiraling out of control and the difficulty that the Census Bureau was having trying to keep it together and put on a good face, you challenged the administration, the Trump administration, and asked that there be an extension of the time for people to respond to the census. Because there was no way, given all of the confusion that was happening at the federal level and all of the confusion that was going on in our communities, that people would know what to do and how to respond. Well, they listened. So in terms of what's going on with the census, the original deadline right now, if there was no COVID-19, the Census Bureau will be out in the public, yes, in Minneapolis too, trying to knock on doors, Nana, and trying to knock on immigrant doors and trying to knock on our doors where there's unrest and so forth, and just a sense of, despair, trying to get the census count. But because of the push that we made to move it, the new deadline is now October 31st. So we have time now to educate our community about the importance of the census and to get an actual count. What organizations have had to do, like the National Urban League, was pivot. We've had to master the pivot. All this work that we did, you talked about 2 years ago, all these strategies, all these tool books, we were going to do canvassing, we were going to engage public libraries, that's out the window. And we've had to learn to be nimble and move with this thing, get ahead of it. Even if the administration wasn't ahead of it, we had to protect the Black count. So what's going on right now? Well, things are a little troubling. The national response rate for the 2020 census is about 60%. That's 6 points behind where the census was in 2010. Secondly, we're seeing cities with heavily or predominantly Black populations trailing the national count, which is already behind the 2010 count, sometimes with as much as 20 percentage points. And we're talking about localities like Newark, New Jersey, down in the 40% response rate, Miami, Florida, and Little Haiti. We're talking about Los Angeles, and we're talking about St. Louis, Detroit, Newark, New Jersey, New York City, where you are, Mark, very hard, they're struggling right now. So we know, and we're educating our populations, that programs like Head Start and WIC, school lunch, Pell Grants, all those things will be jeopardized for the low census count. And because of this time that we have, and also with respect to Black immigrants, where immigrant-rich populations are in Queens and Brooklyn and the Bronx, we're seeing response rates that are as low as 34% if we look at them on a week-by-week basis. So this extra time that the Urban League lobbied for, fought for, I can tell you, I was on a call just right before this session we're having now with the Census Bureau. They needed that time, and so does the Black population.
I think it was pretty intuitive when COVID started that there would be a need for additional time. And ladies and gentlemen, Jerry and I and the Black Census Roundtable and the National Urban League are working on a comprehensive report. It'll be a state of the census report that we're going to release very soon that paints a picture of where we are vis-a-vis the census. Let me say something clearly and unambiguously. It is a state of emergency when the response rates are 10% perhaps behind the response rates of 2010. It is a state of emergency. And we're going to have to wake up and demand that the Census Bureau elevate its activities and elevate its work and elevate its enumerator program, its door knocking program to make sure everyone is counted. But if you're listening, you can fill out your census form online by going to mycensus.gov. One form per address. Include on that form everyone that lives in your residence, whether they're related to you or not. We have many multi-generational families. We have people living together who are not related by blood. Every family doesn't get a separate form. If you're living together, whoever's the head of that house has to fill out the form and include everyone on it. Your babies, your children, your grandma, your nana, everybody, as we say back home, your parent, has got to be included on the form. So I wanted to say that. Ted, are you still with us?
Yes, I'm still here.
Ted,
I'm still
from a legislative perspective, and I'll paint this picture because now you're in the Louisiana legislature where now we have 32 Black members, 33 Black members, 32 Black members. And that number grew from 1968 until 1991. The class I joined in 1991, we had 32 Black legislators. How critical is in Louisiana, where we have elected legislators, elected judges, how critical is the census to ensuring that you and your colleagues have what you need when the reapportionment battle comes up?
I'll tell you, we having battles right now. That's why I'm stuck here. And if we had more representatives, more senators of color, we wouldn't be having some of the fights that we're having. And so many issues are coming down to, we talking about the census count. You've been a legislator counting votes here. The first thing we need to do is make sure that our communities are counted. And then the second thing, when we get to redistricting, we have to start focusing on not drawing districts with 90% African-American vote. I know that we're not talking about redistricting today, but that has to be a message that's going across all over the country.
Packing.
Not focusing, no packing. We have some folks
Thank
that are
you
sitting here
so
in 90%
much.
African-American districts. And what that does, that eliminates our opportunity to create more districts. It basically silence the voices of Black people in other districts where they don't have a caucus member representing them. And these issues are extremely critical here, and one of the things with the census here in Louisiana, we have several elections going on. So we're complicating and confusing voters because we're campaigning in the middle of census. So you have some folks that should be focusing on the census and rightfully they're trying to get judgeships. They're running for different things. We have local elections in the middle of this thing. We have a big presidential election in the middle that's taking the focus away from the census. And right now with COVID-19, many of you know my story. I filled out my census application while I was in the hospital on my phone because it was just that important. I spent 6 days in the hospital battling COVID and in the hospital, even talking to the nurses like, hey, did you fill out your census application? And that's just how important it is. And in credit to my mom, she's like, well, why are you sitting there not doing anything? You could do your census application, and started to talk to people in the hospital about it. But I'll tell you that COVID on top of elections that have been delayed, mail-in ballots, we have so many issues facing our community. And for those of us who are census ambassadors, like Jerry said, we have to pivot. We had several activities planned for the weekend before COVID was really a big deal here in Louisiana with the Urban League of Louisiana. We had big census days in Baton Rouge, New Orleans, Shreveport, and Monroe. We had to cancel those. And one of the things we've been doing, we've been trying to get some of those recognizable voices on the radio, some of our local athletes to start talking about the census, because we know that certain members of our community need to hear certain things from those trusted voices. And even for me as the state rep and the politician, some of our folks want to hear from the guy on the radio so they could understand how important it is. We have our young people. What we did is we picked interns at every HBCU. I haven't even talked about the preservation of the legacy of Southern University and Grambling State University, all of the HBCUs across the country. So we put it right there in the lap of those students and told them, you have a stake in this as well. Your education is at stake. So, and then when they're pulled away from their campuses, they have to get on Twitter and they have to get on Instagram, and we've been helping them developing messages. So every SGA president in Louisiana is pushing it out, especially our HBCU
Well, your
president,
leadership,
just reminding the
yeah,
people.
Ted, your leadership has been outstanding, and I'm glad you mentioned students and HBCUs, because we have students, we have those who may be in nursing facilities, those that may be in what are called group quarters, and that includes those who are incarcerated. Jerry, let's talk about the nation's incarcerated population, how they are counted, and how we believe they should be counted, because we have fought this battle. We have a point of view. Talk about that.
So the Census Bureau has this policy called, well, they're called residence rules. And the policy had been, they count you where you usually sleep and eat. Well, you know, they've stretched that rule so that it absolutely applies to people who are incarcerated. Now, if you're in a boarding school, you know, a little Tony boarding school, and your mom paid and dad paid $60,000 a year, you can get counted at home. You can get counted in your home jurisdiction. But if you're in prison, you're going to get counted in these upstate prisons that are far, far away from your community. You're not going to get counted in Baton Rouge. You're not going to get counted in DC. Washington, DC has inmates in Pennsylvania, all over the country. And that's where all of our counts go. We know that Black people, men and women, and our juveniles are disproportionately represented in prison in great numbers. And in great numbers are given our only being 13% of the US population. I think it's like 40%, some astronomical number. And so the Census Bureau counts those prisons. So those communities, those upstate communities, get our resources. That money for Section 8 that you need back in your home is paying for somebody else's Section 8 apartment in upstate. Don't think they don't need Section 8.
What's so unfair about it is that approximately 700,000 people are released each year. So if all these folks are counted where they are incarcerated in the year of 2020, then if you just do the numbers, over 5 years, 3.5 million of them are going to be back in the communities from whence they've come. And they're fundamentally undercounted. The system is a bad system. It's a wrong system. And, you know, we fought during the Obama years on this, and I think it bears sharing that we believed at the end, working with Congressman Clay and a number of others, that we had the Census Bureau poised to change the rule. And then the 2016 election took place, and that opportunity was removed from the table when the new administration took office. And I say that because elections have consequences on census policy. So we're going to be, what is good news is that there are a number of states, I think it may be 20, who have passed state laws such that for state reapportionment, they will count those who are incarcerated at their home residences, not their prison, the prisons where they are housed. So this is an important issue that we have to work on. And then I'm concerned about the count of college students.
Well, let me just go back. Okay.
Yeah.
You know,
talk about both.
Okay. So yes, for the purposes of, you know, those, like you said, for redistricting, those counts will, for those 20 states, that's progress. However, that fair share of that $1.2 trillion is still residing in those other communities. So they, you know, we can kiss that goodbye.
It won't affect the money.
It won't affect the money.
The congressional seats.
And don't forget detention centers in this conversation.
Absolutely.
Because everyone that ends up in a detention center, immigration detention center, does not end up deported. We are disproportionately deported, but we also get to come back. And once again, they count you in the detention center. They don't even talk to you. The guards, they decide who you are, whether you're Black or not. So they can decide that even though you're Jamaican and look like me, they don't think of you as Black, right? Or you're Dominican or you're from Brazil. because we're giving the guards the power to make that determination. And again, even if the person comes back home, that money is going somewhere else. And so a very critical critical piece for immigrants as well.
Yes, it is. And as you said, Mark, about the Prison Policy Institute estimates that about 700,000 formerly incarcerated individuals return to our communities each year. So there are no restrictions on being counted. Unlike voter eligibility, you can be counted, no matter what. The Constitution requires a count of everyone. So we have got to include the brothers and sisters in this count. We have to reach them and let them know that they can change the landscape if they're counted. They have a voice in this.
I just want to make one point. I'm sorry. I'm so sorry. With respect to this conversation about voting, because it's a piece that I wanted to bring up after Representative James had spoken. This is one of the pushes that we make with Black immigrants. This is one space in which you do get to have some effect on the political landscape in your community, regardless of status. You don't have to be a citizen to help on the redistricting end, right? You don't have to be, you can be undocumented and help paint the picture of what electoral politics are going to look like for your community. And you are definitely putting money in, okay? Because immigrants put money in, undocumented immigrants included. We put money into the pot. So you should have some effect on how that money is spent on who is making the decisions about how that money is spent.
I want to thank all three of you for being a part of a great discussion today as we've talked about the Census 2020. We want all of our viewers to know that the work of the National Urban League and the Black Census Roundtable, that both of you all have been an important member of, is going to continue. And here's how. Number one, we're going to continue to push aggressively for a full count. We're going to push the Census Bureau to do additional things now that we know that the count is behind where it was in 2010. Those additional things we'll talk about very soon as we complete the report that we're preparing called the State of the Census Report and the State of the Black Census Report. We will also be encouraging our own community that we take the bull by the horns. We take the power into our hands to ensure that we are counted, to make sure that everyone in our community is counted. I want people to use Facebook and Twitter and use every conceivable tool of Instagram, the phone, every way, because I know we're in COVID and we're socially distancing, to encourage people to press them, push them, and make sure that they filled out that form. I want everyone to know one form per house, include everybody on that form. Forms have been mailed out to many households. They probably should mail, we think they should mail another form out, but you can also go online. You can borrow someone else's computer to go online because it's an address sensitive process. So we want to really, really encourage all of you, and I want to thank each of you for joining us. Nada, thank you so much for your incredible advocacy. Jerry, you've been our leader, our partner, our teacher as senior advisor on the census. I don't know how we could have put what we put together without you. And Ted James, you've just been a voice of Black elected officials in an incredible way, and we want to encourage your continued leadership. So the National Urban League's Legislative Policy Conference continues. We're proud to present one of Congress's rising new stars. She is Ayanna Pressley, an advocate, policymaker, activist, a survivor, and a member of the United States Congress. In November of 2018, Congresswoman Pressley was elected to represent Massachusetts' 7th Congressional District in the U.S. House of Representatives. She became the first woman of color to be elected to Congress from the Commonwealth of Massachusetts. Her district, the 7th District of Massachusetts, is diverse and also an unequal district, requiring someone like Ayanna Pressley whose experiences are reflective of the people. We're proud to present to you at this time, from the great state of Massachusetts, Congresswoman Ayanna Pressley.
Hello, everyone. Congresswoman Ayanna Pressley here. I'm so sorry we can't be together today, but I'm grateful for the opportunity to join you by virtual community as we all do our part to stay home, to keep ourselves and our communities healthy. Now, like so many of you, my top priorities before this pandemic began were ensuring a complete count of our community and every community in our country in the 2020 census. As I'm sure you know, census counts play a central role in everything from apportioning political representation to securing federal funding for local projects to determining where our grocery stores and transit stations are located. And for far too long, our community and communities like it have been chronically undercounted, resulting in decades of underinvestment by the federal government. Now, I've been hard at work with good partners like you to raise awareness about the census here in Boston, because at the end of the day, if you're not counted, you don't count. Now, the COVID-19 crisis has undeniably shifted focus from the census, and unfortunately, the timing couldn't have been much worse. With states across the country shutting down just days before the in-person census count was set to begin, like so many aspects of our lives, this pandemic has made counting our communities more difficult and complicated. But it has also underscored just how important a full and fair count is. COVID-19 cases and fatality rates are significantly higher in communities of color. Now, this isn't due to any sort of genetic predisposition, but because of systemic factors which have made our communities more significantly vulnerable. We're less likely to have access to affordable produce and fresh food, and more likely to live in neighborhoods polluted with smog and emissions, making us more vulnerable to diseases like asthma and heart disease. For too long, we have not had the representation we deserve at decision-making tables. This is a crisis and a tragedy, but the good news is that each of us has the power to do something about it. By ensuring a complete count of our communities, we have the power to turn the tide on systemic underinvestment and instead to ensure that our neighborhoods get the resources, funding, and support we deserve. If you haven't already, I hope you'll go complete the census for your household as soon as the session is over. Completing your census takes less than 10 minutes, can be done on paper, over the phone, or online at my2020census.gov. Completing your census is the #1 most important thing you can do to guarantee that you're counted and your voice is heard. Now, if you've already filled out your census, thank you. Now, I need you to help get those around you to do the exact same thing. Earlier this year, I initiated a census challenge to encourage folks in our community to complete the census. The challenge is simple. Fill out your census and then challenge 3 other people to do the same. So today, I'm challenging all of you to take the census challenge. Take a moment to challenge 3 people. They can be neighbors, friends, family members, anybody really, to take the census and encourage them to pass the challenge along. This may seem small, but if we all participate, we can make a big difference. I am so grateful for the partnership of the National Urban League and each of you for elevating this critical issue and remaining focused on ensuring a full count of our communities. Together, we have the power to secure representation and to build a more equitable and just world for all.
The National Urban League's Legislative Policy Conference continues. Make Black count. That's our call. Let's ensure that we are all counted, that that count is complete, and that count is accurate, because it is about our power. It is about our economics. Thank you.
It's an underlying theme that I often hear when a patient will call. They say that they often were so nervous about calling because they thought they'd just be another number. And when they call our program, they leave feeling like they're cared about, that we're here for them, that if anything changes, they know they can come back to us and get more help.
We are all united with one thing, and that's just to help somebody else. And we get to do that every single day.
I'd like to welcome all of you to this session, which is entitled From Disaster to Equity, Addressing Health Disparities in the Midst of a Pandemic. COVID-19 has manifested already existing disparities in healthcare. Even before this pandemic, the data showed that people of color are more likely to be uninsured. The uninsurance rate among white people is 8%. Among Black people, it's 11%. And among Latinos, a shocking 19%. While African Americans face higher rates of pre-existing conditions, which increase the severity and the mortality of coronavirus, the Centers for Disease Control have told us that high blood pressure is the most common heart ailment among non-Hispanic Black adults at the rate of 54%. And Black people also have the highest death rate from this heart disease. The risk of having diabetes is 77% higher among African Americans than among non-Hispanic white Americans. Furthermore, many southern states, which is where most African Americans still live, have refused to expand Medicaid under the Affordable Care Act. And there is a rural hospital crisis in this country that denies healthcare to millions of Black Americans. And a history of environmental racism leaves communities of color facing higher rates of pollution and asthma. All of this is made even more dangerous as Black and Latino workers are more likely to be in jobs that are deemed essential. We all know the statistic that 1 in 5 African Americans has a job that allows them to work remotely. 1 in 6 for people in the Latinx community, which means disproportionately, people of color have to go to work, and they are more likely to work in jobs that are frontline, high contact, high risk for exposure to the coronavirus. The National Urban League and other civil rights organizations have called for the release of demographic data on coronavirus testing, diagnoses, treatment, and outcomes. The only way that we're going to get ahead of this problem is to know who is being tested, what are the results of those tests, and what are the therapeutics and the treatments and the vaccines that will eventually bring this virus to heel. Today's panelists will help us look at what policies and actions need to be taken in order to address the severe health disparities. We're pleased to bring to you today an esteemed panel. We begin with Dr. Tim Garnett, the Chief Medical Officer and Senior Vice President at Eli Lilly. We will also bring to you Melanie Campbell, the President and CEO of the National Coalition on Black Civic Participation. She is also the convener of the Black Women's Roundtable Public Policy Network. Next is Cassandra Jennings, the President and CEO of the Sacramento Urban League. And I'm your moderator, Clint Odom. I'm going to turn to our panelists and start with Cassandra Jennings. She gets the privilege of going first as an urban leaguer. I hope the rest of the panelists don't mind. This will be the only time in the world in which this happens. So Cassandra, over the years, the Greater Sacramento Urban League has become an integral part of the surrounding community by providing services free of charge to thousands of historically underrepresented and underserved people. Can you share how the coronavirus is affecting the needs in your community? And also, please, from your perspective, tell us what you hope to accomplish on the new National Advisory Board to which you were recently appointed, this Centene National Health Disparities Task Force.
Yes, thank you. Thank you, Clint, and thank you for the privilege of going first.
To be a part of the national network and movement for the Urban League is just a great pleasure and honor of mine. The Greater Sacramento Urban League has been assisting individuals and families to achieve economic self-reliance for over 52 years. We're fairly young to some of the other affiliates that have been around nearly 100 or more years. But as part of the work that we do, we help people prepare for jobs and entrepreneurship and educational attainment and civic engagement. And we provide support services, and that's all of those wraparound services that are needed for families and individuals to survive and thrive. So before the coronavirus, we were providing assistance in transportation, utility payment, rental assistance, mostly working in underserved communities that are under-resourced, that are food deserts, that people without health care, and all of those issues that seem to really affect our communities disproportionately. We're also a part of a collective that is focusing on the disproportionate deaths of African American children in certain zip codes. Often the data shows that they are dying 2, sometimes 3 and 4 times more likely than their white counterparts. That has to do with the social determinants of health by zip code that we are always faced with. So then when you get coronavirus, that just exacerbates the situation. We're now finding ourselves delivering food on a regular basis to families with masks and with gloves. We're finding that testing is not available. So we are busy trying to make sure that testing is close to the neighborhoods where the people of color, the people without health care, the people who have those predetermined situations that they can be exposed to. So now we're providing cash assistance for rent payments, for medicine, for food, for utilities, for just those basic things. We're calling on families, we're providing kits for their children, and we're even providing Chromebooks in conjunction with the school districts to make sure that the students are ready for the distance learning that is now and likely to be in the future. So with the coronavirus has really changed the needs of our community. And 2 things are really obvious. One is the digital divide, and the other is the disparities in health. So it's my pleasure to be recently appointed to the committee with Centene. And we really expect, first of all, I think the outcome for me and the reason that I'm so excited being on it is that we need to have healthier communities. When viruses come like this, it really just sort of shines a bright light on the deficiencies in our community. And you know, they say when everybody else gets the flu, Black people get pneumonia. I think that's what we're seeing now in our communities. And so what I expect to get out of this committee are 3 things basically. First is to really look at the research and the causes that are around the disparities of health around coronavirus. Sometimes we have a tendency to address the symptoms rather than the problem. So the first is really to have access to good research and data. And then the second would be to make recommendations to Centene that they can assist in their policies and practices to really address the underserved communities. And I would say we're partnering with them now with HealthNet, where we're trying to get people in early to get their tests, to check their blood pressure, to check the diabetes, because that preventive medicine, that preventive attention will then help us in the long run. And then thirdly, we want to make sure that once we made these recommendations, and hopefully it'll be a model for others to model after, the third thing is that we want to make sure to educate and inform the key stakeholders throughout our communities of what this means to our community. So we can have an educated community and it all leads to a healthier community.
Thank you very much. I'd like to turn to Dr. Tim Garnett. Dr. Garnett, as you know, African Americans, Latinos, and other racial and ethnic minority groups have been disproportionately hit by the virus. Yet they've traditionally been underrepresented in what is now becoming all too critical clinical trials. As you know, if we're going to bring our economy back to full swing, we've got to be able to have therapeutics, prophylaxis, we've got to have vaccines. Those are going to be the things that give people confidence to venture out and start trying to resume some resemblance of life. So given the outsized impact of the coronavirus on communities of color, are patients of color finding their ways into research studies that will eventually lead to the kinds of drugs that will help us bring this disease under control?
Thank you, Clint. And first, let me say it's a pleasure to be here today. Lily has been a longtime supporter of the National Urban League, so I'm really very pleased to be able to join this panel and tell you about some of the things that we're doing at Lilly, not just to fight COVID-19, but also to make sure that the studies that we're engaged in are representative of the populations who are being impacted. And as you say, African American and Hispanic populations are being hugely disproportionately impacted by this disease. It's extremely important that our clinical trials represent the populations that are going to take our medicines. And there are many reasons for that, but there are differences in ethnicity, gender, pre-existing conditions that can impact the response of a medicine. So this is a problem and an issue that we've been fighting for many years, and not just in relation to COVID-19, but I think maybe, and my hope is that COVID-19 will maybe shine a light on this problem more specifically and help us really move the needle when it comes to recruiting patients from minority groups into our clinical trials, where they are chronically underrepresented at the moment. Firstly, let me tell you a little bit about what we've been doing at Eli Lilly to fight COVID-19, and there are two things. Firstly, we started a drive-through clinic in the city of Indianapolis, where Eli Lilly is based, and we've offered that free of charge to anyone in our community who has needed COVID-19 testing at a time when the state wasn't yet up and running with its full program. So we're very proud of what we've been able to do to support the state and to support the community in Indianapolis. And specifically, Indianapolis, downtown Indianapolis, has a very large African American and Hispanic population, and we've engaged in specific outreach to those communities to make sure that they are being tested as well when and if they need it. So we're very proud of that. Now I'm pleased to say that the state's facilities have increased, so we don't need to rely on our own drive-through clinics so much. But maybe more importantly, we've engaged in a number of therapeutic initiatives to try and find some treatments for COVID. And there are two kinds that we're engaged in. Firstly, medicines that are already on the market that might play a role in treating patients who are already infected, so reusing existing medicines. And secondly, developing antibodies that can be used either as a prophylaxis for people who are at high risk or for people at very early stages of the development of the disease. Lilly is not a vaccine company, so we are not developing a vaccine, which is the third leg. So there are three kinds of treatment. There are treatments for patients who already have the disease who need support, particularly when it comes to the respiratory symptoms. There are medicines like antibodies to stop people getting the disease or treat the early stages, and then there are vaccines. The studies that Lilly have been engaged in are all hospital-based studies. So what we've done to ensure that the populations who receive our medicines or in the clinical trials are representative appropriately is we've focused on cities and states that have been disproportionately impacted, like Detroit, Chicago, New York, even our own home state of Indianapolis, home city of Indianapolis. And so by targeting hospitals in those states which are disproportionately impacted, which all have large minority populations, we're trying to ensure that we will appropriately represent the African American and Hispanic populations in our clinical trials. The other thing we're doing is making sure that the investigators that we recruit are also from those populations. We've learned that by recruiting African American, Hispanic investigators into our clinical trials increases the probability that they will in turn recruit representative patients from those communities. So when it comes to our specific work to support COVID-19, we've been very deliberate in ensuring that the patients who we recruit into our clinical trials are indeed representative, because this disease is really running rife through the minority populations in this country, particularly in inner city areas. But as I said earlier, this is not a new problem. This is a problem that we faced as an industry for many years, that African Americans and especially Hispanic patients do not participate in clinical trials frequently at all. There are many reasons for that. There are social reasons, there are economic reasons. That in the Hispanic community, it may relate to their status in the country and their unwillingness to participate in the clinical trial if they don't have full residency status. So at Lilly and with other companies, we've been working with the FDA over the course of the last 5 or 10 years to try and change this and make sure that we are recruiting from these populations appropriately. Because if our clinical studies don't represent the populations, it means that when we launch a new medicine on the market, we're running an experiment with those minority groups because we haven't studied them adequately. I'm pleased to say that we are making progress in this respect. If we look at the representation of African Americans in clinical trials, certainly at Eli Lilly, it has increased over the course of the last 5 years, but it's still not increased to the point that it's representative of the number of African Americans in the overall population. So we still have some work to do. And my hope, maybe it's a naive hope, but my hope is that this COVID-19 epidemic or pandemic will really focus on the fact that we need to make sure that minority populations are represented in our studies. And I think there's an opportunity here that we need to take to make sure that we really are able to reach African American and other minority groups in a way that makes them feel comfortable to participate in clinical trials and understand themselves why that's so important for us that we have a representative study. So those are the things we're doing at the moment. It's exciting and busy times at the company. I don't think I've ever been so busy with all the things that we're doing, but we are making progress. And I will just add that we had the first human dose of our antibody study on Friday, which was lightning quick. And we're hopeful that we'll have some data to show whether that's effective within the next month or 6 weeks. So things are going very quickly here, as they are in many other pharma companies who are really dedicating huge resources for this global pandemic.
Well, Dr. Garnett, I hope you will remember your partners at the National Urban League and our affiliates throughout the 36 states. We would love to be supportive of any kind of clinical testing that the company is doing. We know one of the challenges to clinical testing, especially for communities of color, is sometimes the expense of being able to transport yourself on a regular basis to a testing site. These are things that we've been working with you and other partners in Congress to see if we can get more flexibility so that we can have more long-term participation of people of color in these clinical tests. So I hope you will continue to partner with us and look for new ways to do so in order to make sure that people of color are properly represented in this testing. So thank you for all that you do. Melanie Campbell, my dear friend, my dear sister, you are the head of the Black Women's Roundtable, among many things. And I'd like to ask you about some of the health disparities that are unique to Black women. In my time on the Hill, we've talked a lot about maternal mortality, for instance, as a health crisis that seems to not be getting the attention that it needs. Given your years of experience organizing communities to create change at the federal, state, and local level, how can advocates push governments to create a more equitable response in their COVID relief and recovery efforts?
Thank you, Clint, and thank you for all you do. You one of those quiet storm brothers. Get it done. I appreciate you and all my colleagues here on the panel, and our relationship that we have with the Urban League. I wear the hat of Black Women's Roundtable, but I'm also president and CEO of the National Coalition, and the Urban League helped found our organization almost 45 years ago now, believe it or not.
We're trying to find some more for you.
Yeah,
Melanie.
no,
what
no,
you need?
No more. Cassandra, I have two jobs, full-time jobs, and one paycheck. So equal pay. It's not happening. But I was listening your colleague here from Eli Lilly, thinking about the realities that history is also a challenge for us when it comes to the Tuskegee experiment. That still lingers on people's mind. Young people today talk about things like that. They'll bring up Tuskegee, if they know the history. So I think there's a lot of cultural, historic reasons for that. I'm a Southern girl, grew up in Florida, spent a lot of years in Atlanta and in Georgia. And I mean, you talked about the South. So before I get into the question, I think the other part of it is to understand that the disparities that we face, even as we fought hard during the Obama administration to have the Affordable Care Act passed, the implementation of and the backlash from especially Southern governors who would not implement Medicaid expansion. We're seeing the results of that in this coronavirus pandemic. Access to quality health care, really, really critical. And being able to address issues of implicit bias when it comes to us, how we're impacted. You hear all the stories where folks will say, well, I went back to the hospital 3 or 4 times, right? And they sent me back home, not believing, that's not just Black women, but Black people and other people of color, I'm sure, face those, that implicit bias from the medical profession itself. The ability to address the kinds of disparities you talked about, high incidence of high blood pressure, the impact of diabetes, really, really, really vital. So when you talk about solutions, I think we have to address the kinds of things when it comes to access to health care, to even be able to address those things. Access to the impact of low-income communities that don't have access to quality food, food deserts. I know that just in this coronavirus period, my church right here in the DC, Maryland, Virginia area, we're feeding so many families who even in the quote unquote high income general region of the country, folks are not having access to quality food and having to have find coronavirus strategies, if you will, to even provide food for folks. Access to PPEs, masks and gloves, and being able to kind of get that out there for our community. So as we go through it, yes, there are legislative fixes, but those legislative fixes are going to require a Senate that will pass the kind of, you worked a lot of years on the Hill, right? And still dealing with Capitol Hill. In the election year, it's a big issue. Our research, Black Women's Roundtable, we do research with Essence every year, as you well know, right? And thank you for lifting that research up for us. Every year, affordable health care is up there. But what's also superseded that is the issue of systemic racism. Racism is really a health crisis. It's part of the health crisis. Impacts of race and hate crimes are top right there along with affordable health care. It's shifted in this political climate that we find ourselves in with lack of leadership. That's just Melanie Campbell. I'm not saying everybody is saying that. I'm saying that we have a lack of leadership at the top of this country right now that is really having adverse effects on our lives, not just our health, but living. I'm going to stop there. There's much more I could say, but the reality of being able to deal with legislation, change, and access to healthcare to me is number one, and also dealing with issues of implicit bias as it plays out in the healthcare system. And I could say more, but I'll stop there.
So, Dr. Garnett, I was impressed by the position that Lilly has taken. It's been very intentional and very deliberate in going into places where we know the virus exists at high levels. When we take a look at testing, and I understand that Eli Lilly may not be in the testing product market, but can you talk a little bit about the importance of being deliberate and intentional in deploying resources like testing It's one thing to have testing widely available to anyone who can drive up in a car and be tested. But if you don't have a car, or if you don't have a testing facility in your neighborhood or nearby, what do you believe that we have a policy of intentionality when it comes to testing in this country? Do we go to the places where we know we're going to find coronavirus? And what lessons can the United States government take from Eli Lilly in how one goes about trying to bring an end to this pandemic by going to where we know the disease lives?
I think that's a great question. Eli Lilly is not a diagnostic company. We don't commercially produce tests, but we did, within our own laboratory, develop a test that we've used in the local community and to test Lilly employees and healthcare workers and emergency workers in Indianapolis. And we set this up as a drive-through clinic. And I'll be honest, it was only after we set it up that we realized that we had a clinic that was dependent on people having a car, and it was dependent on them having an iPhone. And then you realize very quickly that that's not everybody in our community. And certainly you just have to look at the downtown city center community in Indianapolis, and you realize that there's a lot of people there who don't have cars, don't have iPhones. And so even we, in our well-intentioned, trying to do the right thing for the community, we missed the mark to some extent. And so we had to correct for that. And working with local government, we were able to set up through some local churches and other healthcare organizations that were targeting underprivileged communities. We're able to support outreach to go into those communities rather than rely on people to drive to us. But I think your question is a broader one as to whether there's really a coherent testing policy in the country. And the problem is, no, there is not. Each state has got its own rules, has got its own capacity. If you look at the ability to get tests, it varies enormously across the country. I happen to be in California at the moment. You can go and get a test anytime you want, just in where I'm living, with no problem at all. In other states in the country, it's extraordinarily difficult. So when we look at the rates of virus in the community and the data that is collected, you have to recognize that the availability of testing impacts and biases those results enormously. And there really isn't a coherent approach to testing here. Now, if you compare that to some other countries, and the one that I think has been most taught about is South Korea, where they had a very intensive early intervention with the availability of testing from day one. And if you look at what's happened in South Korea, they have been extraordinarily effective, because every time anyone tests positive, they've also followed that up with contact tracing. Now, contact tracing worries people a little bit because they think someone is going to knock on their door and ask who they've been talking to. And that's not what happens. Contact tracing is somebody on the end of the phone asking you who you've met with in the previous 7 or 10 days before you potentially became symptomatic and started the ability to spread the disease. And it's an important part of controlling the disease in our community. And yet there is not consistent contact tracing in state by state. So I think the challenge we have here in the US is that whether you are in an area that, whether you have access to testing of the virus is highly dependent on where you happen to live and which community you happen to be in. And we know that the underprivileged communities are the last ones who are going to reap the benefits of free testing.
And
It's a sad but unfortunate truth. Yes, please.
Yeah, and I was just, if I could just add, certainly support that access is critical. And I think while we're catching up now, initially testing was not in our communities at all. And the requirement was, in fact, you had to have a car and a computer. And so
and maybe even symptomatic, right? Sometimes you can only get a test if you presented symptoms. Right.
You're right. And so now we're trying to reach out to people and say, you don't have to have symptoms, go get tested. And we have identified at least a half a dozen sites already, and we're still identifying sites in the community. And now you can call, you don't need a computer. Now, obviously, to get the results, If they need a computer, then the Urban League would be there to be able to assist them in our job center or computer lab, or, you know, help them with their phone. But it's important that we reach out to our communities and get them tested. And until then, it was sort of a mystery. So good news, we're now on it, but it didn't, we've been in this situation a couple of months now. We should have started at the very beginning. So it is important. And I think the other thing I wanted to add was about the contact tracers and or the community health workers, because I heard Melanie and Dr. Garnett speak to that point. And what we've been able to do here in Sacramento is we had already started a partnership with HealthNet, with WellSpace, with the community college to do what we call a community health workers program, which is a certificate program with people that look like the community to train them to serve the community. And so the more that we can have people that look like and can relate to people that are being serviced, the better we can get them to access the healthcare and be successful in treating whatever needs they may have.
Just
Sandra,
maybe
that's
another comment
that's a
on
great point.
Just maybe
No,
another
please.
comment on testing. There are two kinds of tests I think it's important to be clear about. There is the test for the virus. So that's the test you have if you've got symptoms or if you think you've been in contact with somebody, and it tells you whether you are shedding the virus and potentially therefore can give it to other people. And that's usually a test of a nasopharyngeal swab that's stuck up the nose. I've had it done myself. It's not very nice. Or it can be a saliva test as well. And I'm sure there'll be quicker and easier tests coming out in the future. But that's the test for the virus. The other test that's available is for the antibody. So if you have the virus, if you have COVID-19, you will develop antibodies that are what essentially kill the virus. And so that test tells you whether you've had it. And the advantage of having that test is that if you've got antibodies, you can relax a little bit because you're not going to get COVID-19 again. So that's an important test. And again, here in California, that's the test that is very widely available now, certainly where I am in California. But if you're in Indiana, you can't get that test yet. It's only just coming out. So huge variability. Just to say about the antibody test, though, just because it's not all good news, we know that if you have the antibodies, it means you can't get COVID-19. But this virus will mutate, just like the flu virus does. And just as you can get flu more than once, maybe you'll be able to get the COVID-19, or by then it might be COVID-20, but you may be able to get the other, a further version of the virus. So having antibodies may or may not protect you from getting COVID in the future. We just don't know the answer to that yet.
Gotcha. I noticed in both your remarks and Cassandra's, you both touched on the need for really cultural competence and familiarity as the touchstones of successful clinical trials or contact tracing. The National Urban League has advocated, and of course we've talked during this legislative conference with Chairman Bobby Scott of Virginia, who's the chair of the House Labor and Education Committee. Contact tracing has to be a major part of bringing an end to this virus, both in terms of human contact tracers as well as using technology. One of the things that we'd like to do in building on the success that Cassandra has had in Sacramento is really use contact tracing as a jobs program. We're, by some estimates, and Dr. Garnett, correct me if I'm wrong, but we might need as many as 500,000 people spread out across the United States doing this contact tracing. And if we can pass this HEROES Act that the House has passed and is now going to the Senate, inside that bill is a provision that would provide grants for local not-for-profits and other organizations to actually train people in how to contact trace and deploy them. That's something we've advocated for, and we certainly hope is something that actually ends up on the president's desk, that contact tracing in particular. I feel like we could talk for days on this subject. Dr. Garnett, I was intrigued by the two tests that you laid out and the occasional conflation of testing numbers by certain states to make it appear that they're testing numbers are really high. You know, I promise not to talk about that today, but it would instead like to start with Melanie in helping us to close out here. I want to be respectful of your time. I know that you are all on the front lines fighting this pandemic and fighting for social justice. In a word or a few words, Melanie, can you tell us what policies and programs we should have in place now so that future crises like the one that we're living through don't have a disparate impact on communities of color? Does it always have to be the case that if they catch the cold, we catch pneumonia? Is that just the way it has to be?
It can't. Well, glass half full. This can get better, right? I think building on access to healthcare is like vital. But one thing I want to step back on, because you brought up HEROES Act, I was like, yeah, I was going to say something, so you already brought that up. But one of the things that's really important to also understand is that when we're talking about the workforce, the Black workforce, 70% of us are not able to shelter at home. So that's why we've also been really pushing for there to be access to paid family and sick leave. How critical and vital that is, because we're frontline workers, essential workers, right? We talk about working on the front lines in jobs that pay lower wages. Black women are disproportionately in that labor force, as well as other people of color. So that reality is really, really there. So we are really pushing that we keep pushing for that access to health care. Because at the end of the day, if you can't get health care and you get to where you can prevent some of these disparities, the next corona, whatever it may be, and where you're talking about the fact that if you have if we can't get to dealing with pre-existing conditions and being able to deal with wellness, then what are we saying? We're only going to be right back where we are. And you're right. This coronavirus impacts everybody, including myself. I have pre-existing conditions, right? Being able to be out on the front line is a different decision I have to make when I walk out the door, right? To go out here and try to make sure our folks are not, as we're dealing with, not to get into this, but I can't help but bring up what we're dealing with what's happening with the killing of George Floyd and others in recent times that's causing the unrest, not just nationally but globally. We're also having a pandemic. We're having a tsunami of being able to have to fight racial issues in the middle of a pandemic. So think about all the people who are out here now, all our young people who are out here on the front lines of this protest, who are stepping out there. So we in the short run, the HEROES Act has to get passed. We have to get that. We also, in the course of that, have to make sure that we have pushed for access to health care now. It can't wait 2 years from now. It can't wait till after the election. It's a right now. We have to push for paid family and sick leave, so those who are on the front lines of this fight have access to health care. So those are some of the things. And I thank you for the opportunity to be a part of this really, really critical issue. And thank you, as I say, your quiet storm, my brother, pushing the legislation needs to be pushed to make sure that our people can live.
Well, don't be out there with those little cloth masks. If you need an N95, I'll bring it to you. I'll also go out and make sure people stay 6 feet away from you if you got to be out.
Okay. Oh, I'm in the grocery store saying 6 feet. That's my line in the grocery store. 6 feet, 6 feet. Hey. Especially if you don't have on a mask.
Absolutely.
I'm a Southern girl, but I've learned to be stern and polite to back off.
Dr. Garnett, what are some of your thoughts? You've heard a lot here today, and what are really some of the messages that you'd like to convey to the people who are watching us today, or might watch us, on a recorded basis?
Yeah, thank you very much. Firstly, thank you for this opportunity. It's been a great pleasure. I think I spoke a lot about what we're doing to try and ensure that we have minority representation in our clinical trials. But of course, if people don't have good healthcare, if they don't have access to healthcare, they're never going to enroll in a clinical trial. They won't even have that opportunity. So that really is the fundamental issue here, is ensuring good healthcare, high quality healthcare, and access to that healthcare to all communities. And trying to be an optimist, I hope that the aftermath of this pandemic, when we get to the point that we're at the aftermath, I hope that the aftermath of this will be that it has shone a light on the disparity of healthcare in this country and how impactful that can be to a disease and a pandemic like COVID-19, which is really disproportionately hitting some communities. So yes, of course, we want to make sure that we're recruiting patients into our clinical trials that are representative of our population, but we can't get even close to that until we ensure that people have good health care. And my hope is that this huge disparity that we're seeing as a result of COVID-19 will really make people realize what a major issue that continues to be in this country.
Thank you, Doctor. And Cassandra, she who is first shall be last. And I want to turn it over to you to share some of your thoughts of what you've heard here today and your experience on the ground, and what do our listeners and viewers need to hear today from you?
Well, I thank you for the opportunity, and Melanie and Dr. Gardner, you guys are excellent. I think we're right on. I think obviously affordable health care for all should be a right, and we should not stop short of anything but that. At all levels, we need to make sure that people have access and that they take advantage of the access. I will say, in addition to that, I think we have an opportunity when you talk about access is telehealth. And especially now as we're still some staying at home, and then even in the future, it makes sense in many cases. And I think what the coronavirus has allowed us to do is look at options. And I know we're supporting some legislation now in California that will look at teledentistry and different things that could be affordable and accessible to communities of color. So let's certainly be open to that as we look at access and affordability. And I will say, around this trying time that we're in, not only the pandemic, but the social unrest, I think we have an opportunity as nonprofits and urban leagues and organizations and companies to really seize the moment and see where our space is to really impact our communities in a positive way. And for the urban leaguers, I would say, let's go after the CARES money now. Many of us are in cities that are over 500,000. There are resources out there. We're going after those funds for our communities and for the health aspect. We're going after to create these training programs for contact tracers, for community health workers. And even aside of that, let's look at the established organizations like the community colleges and the training agencies and make sure that we are accessing those resources all around health for our communities and jobs and security and sort of that relationship that we would be doing. I think I always try to look for the silver lining in things. And I think as bad as it is, this virus, it says that we can do some things differently, and we need to stay the course in trying to bring not only jobs and opportunities and justice, but also health is our first wealth. So if we can look at these disparities and address them, then we all can be healthy and wealthy.
Thank you for closing us out, Cassandra. And I'd like to thank all of our guests for their participation today. We've learned a lot that we hope that you can take back to your home communities. I'd like to thank Dr. Tim Garnett with our partner Lilly. I'd like to thank Cassandra Jennings with the Sacramento Urban League. And last but certainly not least, I'd like to thank our friend and our colleague Melanie Campbell for your participation today. We hope that you tune in to the next session that's coming up, and we bid you a safe and healthy goodbye. And now I'd like to present to you a video from the Congressional Black Caucus Health Brain Trust, the chairman of the CBC Health Brain Trust, Congresswoman Robin Kelly, proudly representing the 2nd District of Illinois.
Hi, this is Congresswoman Robin Kelly. Unfortunately, we cannot be together in person for this year's National Urban League's Policy Conference. But I'm glad that the National Urban League was still able to bring us together digitally for this important conversation. As chair of the Congressional Black Caucus Health Brain Trust, I'm especially glad to be joining you for this session, From Disaster to Equity, addressing health disparities in the midst of a pandemic. And I'm happy to be sharing this session with my friend and my senator, Tammy Duckworth. I'm sure she will tell you about the ongoing efforts in the Senate to combat COVID-19. From the House side of the Capitol, we are hard at work under the leadership of Speaker Pelosi to support families, small business, nonprofits, and communities during and after the COVID-19 pandemic. As you know, we passed a number of measures to date, and we continue working on others. To be clear, the elements of these bills that invest in our communities and families would not have been included without a democratically controlled House. Our GOP colleagues did not want to expand unemployment benefits or provide direct stimulus to families. They fought us tooth and nail over language to collect and analyze COVID-19 racial data. And they wanted to reduce the SBA funds that's specifically designed to support minority-owned businesses through small and minority-owned financial institutions. At each step of the way, we've held the line and fought for good policies that uplift and empower families and communities. And we will continue holding the line for all future deals. While COVID-19 has changed a number of things in Washington and forced us to innovate, it has also highlighted facts that we already knew. As more and more data come out, we see that African Americans and other people of color are dying from COVID-19 at higher rates than our white counterparts. While shocking, these numbers are not surprising. This or any pandemic will stress the existing failures our healthcare system, and the greatest impact will be on the most vulnerable. Tragically, due to centuries of health inequities and limited access to care, African Americans and other people of color are the most vulnerable and have more health risk factors. Across the board, African Americans die at disproportionately higher rates from 8 of the 10 top killers of Americans. With these facts in mind, and the biology of COVID-19, no one is shocked that African Americans are dying at higher rates while our communities still receive reduced investments. COVID-19 is an acute problem, but long-term systemic issues that foster health disparities have created an America where some communities suffer more than others. We need to address that, the underlying systemic failures and inequities that makes us all less healthy and less safe. This crisis, this pandemic, should spur us to greater action to address long, lingering, generational healthcare disparities. In 2015, I released the Kelly Report on Health Disparities, which makes a number of recommendations to address, reduce, and end these disparities. You can find the entire report on my website, robinkelly.house.gov. The report is filed under the Resources tab with the other Kelly reports. In addition to the report, many of these recommendations have been included in the Health Equity and Accountability Act, which we call HEA. HEA is a comprehensive bill utilizing the best and brightest ideas from scientists, researchers, the Congressional Black Caucus, the Congressional Hispanic Caucus, and the Congressional Asian Pacific American Caucus. Introduced in this Congress by Congressman Chuy Garcia as H.R. 6637. We already have 86 co-sponsors and continue working to build more support for this important bill. With the shocking racial disparity in COVID-19 deaths staring us in the face, now is the time to act. We need to ensure that all forthcoming COVID-19 response and recovery bills direct resources into the most impacted communities. And we need to use this moment to drive forward our overall agenda of ending health disparities once and for all. In America, the color of your skin or the zip code in which you are born should never determine how long or how well you live, because healthcare is a human right. Thank you again for joining this year's conference and for keeping up the push for real policy change that improves and saves lives.
Good afternoon, and welcome to the Diversity and Digital Inclusion as a Pathway to Corporate Success panel discussion. I am so happy to be here today having this critical discussion at this time. My name is Marie Silla-Dixon, and I am Vice President of Federal and Government Affairs with T-Mobile. I work with a number of different policy organizations and civil rights organizations on policy issues such as broadband deployment and adoption. And I work with a number of the organizations leaders that you're going to hear from today. Given everything that is happening right now in our communities and in this country and around the world, I cannot think of a place that I would rather be right now at this moment than with each of you having this critical discussion. The current protests and outcry around the nation has resulted from mounting frustration, anger, sadness, and yet another Black life ended prematurely at the hands of police. We also know the pain people are experiencing right now, and that runs so much deeper and is tied to the long-standing effects of racism and injustice that Black people and people of color have faced in this country. The disparities in access to opportunity and the chance to succeed itself extends as well to corporate America. Just recently, there was a recent study by the Center for Talent Innovation that found the subject of race is even more of a third rail at work, preventing the frank exploration it merits and allowing systems of privilege to remain in place. And further, representation of Black professionals in leadership and people of color still lags far behind college graduates. I just want to point out these stats as we kind of, set the framework for this discussion. So out of the Fortune 500 CEOs, only 0.8% are African American. That percentage is even lower for Latino. Since 1999, there have only been 17 Black CEOs in the Fortune 500 companies. Only 3.2% of executive senior level officials and manager are Black or people of color. Despite oftentimes people being more ambitious than their white peers, African Americans and people of color are more likely to feel the prejudice in the pursuits of corporate ascendance and face barriers ranging from prejudice and outright discriminations to microaggressions and their non-Black counterparts. I am proud here today to stand before you to let you know that the new T-Mobile, we are a company that prides ourselves on diversity and inclusion. Last October, we entered into a memorandum of understanding with 6 of the multicultural leadership organizations known for many decades of public service and civic involvement. And this was a way for our company to make that commitment to the communities we serve by entering into an agreement, a diversity MOU with 54 commitments focused on corporate governance, leadership diversity, workforce deployment pipeline, and enhancing our supplier diversity programs, ensuring that we are doing our part in bridging the digital divide by creating a superior advanced 5G wireless network that is more accessible to low to moderate income, minority and rural communities, and also making sure that there's critical investment in community development and philanthropic giving in underserved communities and communities of color. Before I go ahead and move forward with introducing the panelists, I first want to start off with a brief video message.
Hey everyone, it's Mike Siebert, CEO of T-Mobile. It's such a privilege to be with you today, at least virtually, at this 17th annual Legislative Policy Conference of the National Urban League. This meeting could not have landed at a more timely moment. The recent injustices perpetrated against Black Americans all across this country continue to weigh heavily on me, and I know on the hearts and minds of anyone who truly loves this country and wants to make it better. I feel as a society, the events of the last month have shown us a huge opportunity to improve. It's an opportunity that's always been there, of course, but Many of us weren't seeing it clearly until now. And you know, opportunity often follows adversity, but it has to be done deliberately. If we don't let this moment pass, we can create opportunity and address systemic racism in a much bigger way. Obviously, racism, hatred, and inequality don't belong in this world, but we know they're real, and we can't just wish them away. We have to take action if we want progress. At T-Mobile, we know our culture is stronger because of the different backgrounds and life experiences of our employees, but we also understand that we really need to do more to combat the systemic racism that infects our organization and really most large organizations. That means making sure everyone feels safe having the right conversations, but it also means advancing beyond conversations and into action. T-Mobile is prepared to step up and step out and speak out to help bring about change, both inside and outside our company. It comes down to things like how we hire, how we recognize and reward employees, how we develop and mentor new talent, how we promote our leaders, just to name a few. And I know it starts with listening, and we have a lot to learn from our friends at the National Urban League. That's just one reason why we signed a partnership MOU with the Urban League and several other leading civil rights organizations, with conversations featured right here at this conference. Our partnership is all about building and expanding on T-Mobile's already nationally recognized diversity and inclusion initiatives. We've made serious and significant commitments to you to improve the diversity of our leadership and workforce at all levels of our company, including our board of directors, to better reflect the diversity of the communities that we serve. We've also made commitments to improve diversity in other areas too, including procurement and supporting diverse entrepreneurs, reaching low-income consumers with outstanding wireless services, including 5G, and of course, philanthropy and community investments. But all this is just a start. We're focused on making concrete steps forward, and it's long past time for real change. As we look forward to our continued partnership, we're all really counting on your leadership at the National Urban League and your guidance at this critical moment in time. Thank you for all you're doing, and I hope you have a great conference.
In today's session, I have the privilege of speaking with 5 leaders who I have been fortunate enough to work with on this diversity MOU, who have a clear strategic vision of what our communities need most, and who are giving that voice to our communities to fight the fight, both right now and in the future. Joining me in today's critical discussion on why diversity and inclusion in tech and innovation matters, I first would like to welcome Janet Murguia, who is President and CEO of Unidos. I also would like to introduce you to Mr. Domingo Garcia, National President, League of United American Citizens. I also would like to introduce you to Sharon Wong, the National President of OCA, Asian Pacific American Advocates. And I also would like to introduce you to Reverend Al Sharpton, founder and president of the National Action Network. And last but not least, Mark Morial, president and CEO of the National Urban League. I am grateful to have the opportunity to speak with each of you today, and I thank you for taking the time to be with us today to have this critical discussion. Especially right now as we talk about the impact of diversity and corporations and what can be done right now. First, I would like to start off with Domingo. LULAC has been party to different partnerships and different diversity MOUs in the past. What do you perceive to be the greatest benefit and opportunities associated with these types of relationships? And how does this MOU and the model it creates change longstanding corporate practices that largely ignored communities of color?
Marie, thank you for bringing us all together and for T-Mobile for working with minority communities to try to bridge that digital gap that exists. One of the things about living in 2020 has been to expose the inequities we've seen. I'm going to start with COVID-19. When COVID-19 hit and people were stay-at-home orders and schools stayed home, what we saw in the Latino community is many Latinos did not have access to a laptop. They didn't have access to a hotspot or Wi-Fi, so they could just get their courses and the online teaching. And that exposed that from New York to Dallas to Los Angeles and Miami, that was a tremendous need to bridge that digital gap just for our children and just for them to get basic educational learning, because that is happening in low-income communities throughout America. And that problem needs to be addressed. And what we seek out of this MOU is how can we bridge that gap? How can companies like T-Mobile and others in the digital world get us up to the same level as everybody else? And that means working on several things. For example, corporate governments. We have no Latinos, basically, very few, and Janet can tell you, on Fortune 500 companies. And we talk about Silicon Valley, few Latinos are there. Even though we're 60 million strong, the largest minority in America, we still are not being represented at the corporate board level. And if we're at there, then we're not at the table. And if we're not at the table, we're on the menu or at the little kids table. And that means that our voices are not as heard as loudly and clearly, and our concerns are. So hopefully the MOU will work to lessen those. And then we talk about contracting, especially minority contractors. Latino businesses are trying to grow and increase as we go forward. And that means that we have to have those people there that can get those contracts to these minority vendors to make sure they're inclusive in a Fortune 500 company. Third, we're talking about employment. A lot of Latinos and Latinas are graduating from college and are looking for opportunities, looking for internships. And we hope that through these programs, we're able to provide them the experience and the background necessary so they can get these type of jobs and go into what we call the new, people always talk about the industrial revolution, changing America. The digital revolution is transforming America. Everything from my kids can't take their eyes off the phone, and one of the things I've learned is there was an old song, for those of you who may remember, the revolution will not be televised. It is being televised right now in 2020 because everybody is carrying an iPhone and televising, or any type of Android phone, and televising what's happening in their neighborhoods. And that brings us to where we're at now, the inequities in our economic system that put Latinos and African Americans with less opportunities, whether educational, economic, at all levels, to just become equal with the rest of America. And that means that we have to fight stronger, whether it was the unfortunate tragedy of an African American man being killed in Minneapolis, Minnesota. But just last week, a Latino in Austin, Texas, Mr. Ramos, was shot by a police officer in his front yard, and he was unarmed. So we're seeing this over and over again. And one of the things that people say, has racism increased? No, it's just being filmed now. And that is transforming America because those videos are out there. And I think that's part of how the digital revolution is also advancing the civil rights revolution that Cesar Chavez and Martin Luther King and many others have fought for. So I'm hopeful that when we get through this, that we're able to use that digital technology to advance equality, to advance the civil rights of all Americans in a positive and meaningful way. And I look forward to working with y'all and everybody else in this panel. Thank you.
Domenico, thank you so much. Sharon, Domenico touched on the impact that the digital divide has been even more exacerbated during this pandemic. But as the nation has gripped with this increasing concern over the spread of coronavirus, we also have witnessed this heightened animosities towards Asian Americans right now. What role do you see a T-Mobile specifically, or other companies? What role can we play in bridging the digital divide, both culturally and in terms of technology access and use? And how do you envision us using this partnership through the MOU to achieve these goals?
So thank you, Marie, for that question. Thanks to everyone for inviting me also to be part of this illustrious panel. I want to just say I appreciate the acknowledgement of the many hate incidents that have been directed at the AAPI community due to COVID-19, right? I'm not sure if you're aware, but right when the stay-at-home orders were put in place, there's a consortium of Asian American Pacific Islander organizations that collected data on hate crimes and hate incidents, and they reported over 1,600 hate incidents just in the first month of those stay-at-home orders. But I think that we have the opportunity to bridge the divide through the MOU that was signed last October, right? Because it served as a model for what corporations can do. When I looked at it, when it talked about the 5 focus areas, right, that's what we need to address. Corporate governance, right? Workforce recruitment and retention, procurement and entrepreneurship, wireless service. And I know this is talking about digital inclusion, right? But it's wireless service for our low-income consumers. And then the third part about philanthropy and community investments. Now, I'm not going to go through every one of these areas, but here's some specific things that I envision how we can use this partnership to bridge the divide amongst all communities of color. So let me start with the fact that companies really need to engage communities of color, right? Particularly in those areas in which they have a footprint. We need to ensure that, I look at this as really strong partnerships with organizations who represent communities of color, because we can provide input on an organization's inclusive diversity initiatives or your councils. And I purposely use the word inclusive diversity, right? For too long, we've said D&I, diversity and inclusion. And a lot of times it's been taken to mean diversity or inclusion, as though you can't have both. But by saying it's inclusive diversity, it is, we know the diversity is there, but how do we then utilize that diversity to ensure that we are including everyone, right? And for these partnerships with organizations representing communities of colors, it's about being committed and accountable. Because too many times, I think organizations do it as a check in the box, right? I have a personal example of many years ago that I was invited as an organization to sit on their external diversity council. And I will tell you that it started out great with much fanfare, but there wasn't much accomplished, okay? So another thing with regards to organizations is participating in local volunteering and civic engagement with your employee resource groups. I know a lot of corporations are doing it, and thanks to the new T-Mobile that you are partnering with OCA on engaging your ERGs in terms of our Asian American Pacific Islander leadership development, and recognizing then the importance of having Asian American Pacific Islanders and other people of color lead your teams in order to serve your customers and communities, right? And another thing is many of these organizations, in addition to their ERGs, I think can partner with the community in terms of, there's a lot of these mentoring programs that a lot of our organizations run, right? And so it's about helping corporate leadership engage in cultural competency and around the idea of sponsorship and uplifting employees of color. Because this is about sponsoring and advocating for employees of color. Because too many times we say it's not just about mentoring, coaching. I'm sure we've heard the term, minorities are over-mentored and under-sponsored. And it's sponsorship that we need to be advocates for people of color and employees of color. All right. And especially in light of what's been happening around the countries, I think a key part of this is companies should stay in tune to what's happening in the country, right? What kind of national events could possibly impact their employees? I think businesses need to be aware of and lead and participate. So it's not just an awareness, right? But lead national conversations regarding race and ethnicity and the importance of workplace diversity and inclusion. And then do something about it, because we can have conversations all day long, but conversations aren't enough without demonstrated action, right? We need to hold leadership accountable for change. We hold them accountable for ensuring stakeholder return on investment. Why can't we hold them accountable for society return on investment? And then sometimes we talk about society as though it's some nebulous body out there. Every one of us is part of society, right? It's also about having meaningful implicit bias trainings. Right? This follows up on the thing about conversation and role play, not just checking the box, because these days everybody is big on implicit bias training. But I will tell you that while it is important to understand the ways our identities play an overt role in interactions with our employees, that is not enough, right? And so companies should also have appropriate responses to changes that might be nationwide. And I want to just recognize the new T-Mobile for signing on to FCC's Keep Americans Connected pledge, because it's about ensuring your customers are experiencing no lapse in service, right? Just a couple other things like developing youth of color. Advocate for full funding for and partnership with minority serving institutions, right? Because this is where we are training the next generation, right? If we look at the workforce, examine our outreach and recruiting processes to make sure they are truly inclusive of communities of color, right? Do your recruiters look like the people you're trying to hire? Does your workforce reflect the population you serve? Is your leadership ranks reflective of your workforce and the population you serve? Are you using diverse panels in your interview and selections process? Are you analyzing applicant flow data to ensure you're reaching a diverse applicant pool? Are you paying everyone the same rate for the same work, right? Because studies continually show that people of color make less than majority males, right? Supplier diversity. Domingo touched on that, right? Engaging with the suppliers, ensuring that businesses are conducted with minority-owned businesses, right? Tap through networks through partners like OCA, LULAC, and all these other minority organizations, okay? Ensure too that multiple languages and support are in outreach materials, right? That is something that's particular for the AAPI community. When COVID-19 hit, I'll tell you, AAPIs and other immigrant-owned businesses were hit hardest because of language access, right? They didn't know how or when to apply for the PPP loans. They had little or no idea on how to transition their business to an online model, okay? And then just finally just want to touch on the digital divide. Digital inclusion, when we talk about it, it's about when all communities have access to and use of information and communication technology. All over the country, we know that gaps exist to create a technological divide at the importance of digital inclusion, right? This occurs for a lot of different factors, socioeconomic, language barriers, geographic location, you name it. People are being left behind in conversations that happen in the digital space. Survey shows big remote learning gaps for low income and special needs children, because it shows that the lowest income parents were 10 times more likely than families making 6 figures and above to say their kids are doing little or no remote learning. And this is 38% versus 3.7%. That means our kids, and particularly kids of color, get further behind than their peers and are highly unlikely to make it up. So broadband access is also not always available, right? People may not be able to afford the internet, and resources to access broadband are often given in English or Spanish, sometimes Chinese. But that's another thing about our AAPI community, right? We're not monolithic. We speak over 40 different languages and dialects, right? Low-income people of color are often vulnerable to data breaches, phishing scams, and targeted predatory scams online. So I'll tell you that we are proud to partner with T-Mobile in their efforts to reach the low-income community, many of which are American Pacific Islanders. Access to broadband has become a civil rights issue. And in this global COVID-19 pandemic, it's become apparent that broadband is not only a right, it is essential for all. So again, let me thank you for the opportunity to address that question.
Sharon, thank you. I think that I like what you had to say on inclusive diversity. And I know from the folks from companies who are listening in, you just laid out the blueprint. So thank you for your advocacy on this. I think it is a critical time right now that we have people speaking up. And I thank you for laying that blueprint for us. Thank you so much. Reverend Sharpton, thank you so much for being here with us today with this discussion. Reverend Sharpton, during the pandemic, the new T-Mobile, we've leaned into diversity, not away from it. And early on, you had described the deal as perhaps the most game-changing MOU, with it being, very comprehensive, a number of the commitments, 55 of them in all. And it's a move that will set the stage for a greater investment back in the community and back with communities of color. in light of all that's going on right now across the country, and the protests honoring the lives of George Floyd, Breonna Taylor, Ahmaud Arbery, and the countless others who have, been taken too soon, how might you suggest we collaborate in this movement through the MOU to make the greatest contribution possible?
Well, I think that the MOU is a game changer, and this can show how, because with the inclusiveness of the MOU and the fact that we are now working to try and deal with closing the digital divide, it gives us a platform to put out messages of information, positive messages from the families that is saying that they want to see reform, but they do not want to see reckless violence. It's a way of communicating with a lot of people that are not getting these messages through mass media, because mass media likes to deal with if it bleeds, it leads in terms of their front page story. We can guide the narrative of how we deal with real police reform, real social justice, without negativism and sensationalism. I can tell you as one that's worked with this family that we're dealing with in Minneapolis in terms of Floyd, that this family is clear that they do not want to see reckless violence. They do not want to see their name tainted with anything other than getting justice for their loved ones and others' loved ones. And I think that if we could make our platforms available to families that are making positive messages and people on the ground that are doing positive things toward reform, those that are marching peacefully, those that are elected officials that are trying to do things, it gives us a way to communicate. And also at the same time, it shows that our diversity and our inclusiveness is not just on paper, but is real even in times of stress. And I think that with the tension that is out there, Martin Luther King used to say creative tension is good. Peaceful protest, raising proper issues is good. What we don't need is people feeling that to break a window is the way to get the attention. We can give them the attention by breaking what has become something that is needed and something that is in many ways brings the country together, because it makes our criminal justice system more equal and even for everyone. So we have a vehicle that could counter the sensationalism of mass media by going en masse with the real messages from the victims and those that engage, from elected officials to civil rights leaders to community activists to people that practice in this area, to get their message out to the most people. I think we can do that with new T-Mobile.
Reverend, thank you.
Thank you. God bless you. Let's work together.
Yeah, well, we are really looking forward to working with you and taking this to the next level, especially right now. Thank you.
All right. I appreciate that. And
Yeah.
certainly our doing that together, and all of the groups that signed on MOU, I'm sure is committed, including he calls himself my younger brother, but he's only 2 or 3 years younger than me, Mark Morial.
Thank you.
All right.
Thank you so much. I now would like to go to someone who has been a champion, a warrior, not just for the Latino community, but all communities of color, and who has been a very passionate advocate as well on social justice issues, but broadband issues. Janet, stepping back and surveying this broader movement and what's going on right now, I think we're gaining a different sensibility towards how much technology, innovation, and communications platforms make in upholding justice, and also securing future social and economic opportunities. From your perspective, why is diversity and inclusion, or as I like to say, how Sharon said it, inclusion and diversity in tech and telecom space, why is that so important to both companies and diverse communities? What role do you see a T-Mobile how and playing, how can and should we play in not only expanding access to high-speed connectivity, but also supporting civil rights and social justice causes that all of you on the panel are fighting the fight for. What role and how can we work with you on that?
Sure. Well, thank you. And I just want to echo the comments of our panelists here today and just say how honored I am to be part of this discussion, and to thank you, Maria, and T-Mobile for being a center part of this. We really appreciate it. Look, we are a civil rights and advocacy organization, but we engage companies on diversity issues because it's not only the right thing to do for our community and our country, but it opens the door of opportunity and, importantly, economic empowerment for our community. And today, tech and technology can provide the kind of 21st century jobs, skilled, well-paid, and sustainable to young Latinos and other people of color who today do not have equal numbers in and equal access to these jobs. We need to make sure that those skills are developed, that knowledge is developed, and tech companies can be our best partners, not just to invest in community, but to invest in their own future success. Diversity makes companies more responsive to their diverse customer base, employees, and to the communities and markets that they are in. Diversity in the highest ranks of companies provides diverse companies with more say and more clout in business and in our society. We need to make sure that companies that claim to have a national reach, that claim to care about their customers, look like the country, look like America, and look like the communities they want to serve. If that is not the case, both in the rank and file, but especially at the leadership level, there is a disconnect. There's a breakdown in how you're going to accomplish, and how any company would want to accomplish its mission today, knowing the demographic statistics that we see out there. But I think it says more about a company's principles of its commitment to communities of color, but also to diversity and to its own success. So for tech companies, the bottom line, especially for tech companies, is if you want to be competitive, you must be diverse. Top talent factor for hires, the top factor for folks who are retaining employees is increasingly, how diverse are you? How are you serving diverse communities? And are you making purpose, mission-oriented commitments, as well as financial, economic spreadsheets that show success? No longer are younger workforces satisfied with the pure economic outcomes of a company. They want to see commitments beyond the financial bottom line, even though the bottom line, we know, can be impacted by diversity. Diversity makes companies more innovative by providing them with new and fresh perspectives. And this is a very important point. Diverse companies are more profitable. A 2018 McKinsey report showed that companies which are diverse in their executive ranks are 33% more profitable than non-diverse companies, and companies with diverse boards are 43% more profitable. We need to see that diversity, not only because it's the right thing to do and it's a commitment to your customers and to your shareholders, but it is a commitment to making sure that your bottom line is successful. For us, we understand that that can be a win-win situation, Diversity and inclusion is just not the right thing to do. It's not the right thing to do, but it's also the smart thing to do for any company in this particular decade and as we look at the future ahead. And we think that looking more like America from a corporate perspective is a win-win for our community and for them. And so that's true across the board, but it's especially true for tech companies today. So I think that if a leader of a corporate enterprise today can understand that fundamentally, that diversity is a strength and it's essential. If you're going to be a successful company today, it will put them on a trajectory to not only being successful financially, but to being strong as a company and sustainable into the future. Diversity is a strength, and that has to be reflective as an inclusive company today in terms of their philosophy and their motto.
Janet, thank you for that. And if anyone hasn't checked out the McKinsey report, I highly recommend it. To Janet's point, it really does show that companies that are more inclusive and diverse really are, it has a huge impact on the company's bottom line and how successful the company is. So,
and Maria, just let me add that, because I want to make sure I'm on record, and we've worked closely with Mark and the participants on this panel, but I want to commend T-Mobile for signing the MOU and making the commitment that we can now all be accountable for. But making those types of commitment in an MOU sends a loud and strong message to communities of color and diverse communities that you're serious not only about making that commitment, but that you're going to be held accountable and that you're going to execute on that commitment. So I commend T-Mobile, and I want to thank Mark Morial and the Urban League for the leadership and the partnership that we have shared, again, with the participants on this panel to work with tech companies, but really happy to see T-Mobile step up and say that you will be accountable and you'll make these commitments, and for signing that MOU. Really appreciate that kind of leadership and commitment at this time.
Janet, thank you. We are, I have to tell you, as a company, it was one of the things that we did as the new T-Mobile that I know all of the employees were, and just the folks at T-Mobile were really, really excited about that MOU being signed. And, a lot of us are change agents here, but for me, I have to tell you, I was really honored to be a part of that. I know that it took a lot of hard work behind the scenes, and was just really proud that I'm at a company that made that commitment, because I do think it's important that we make sure that we are really doing things in the community, especially with the communities that we serve. And I think that the MOU it's a testament to our commitment with the new T-Mobile. So I want to thank each and every one of you, from your organizations, and you for working with us on that negotiation. So thank you. I just want to say a couple things. Mark, is that you are truly a trailblazer on this. I know in the past several other diversity MOUs with telecom carriers, you were very instrumental in spearheading these agreements and getting companies to the table to do this. So I want to thank you for that. I also want to bring up, and I want to ask you, Mark, because you've been working on this for a long time, and can you tell us why these kinds of partnerships are so important and what they mean to the communities and the people that you serve and represent? What is the impact specifically that you can envision this dealing having on the National Urban League and the work that you do each and every day, but especially in light of what is going on right now?
First of all, Marie, let me thank you so much for your tremendous leadership and for hosting and moderating this panel during the 17th Legislative Policy Conference. It's always great to see my friend and brother, Reverend Al Sharpton, my friend and sister, Janet McGeer, who are leading voices on the national stage for civil rights, social justice, corporate diversity and inclusion, immigration reform, criminal justice reform, voting reform. They're great voices, and I'm always proud to be able to share a conversation with them. And Marie, you deserve a great deal of credit, as well as a number of your colleagues at T-Mobile, for what ended up being, I think, a historic memorandum of understanding between the new T-Mobile and a coalition of 6 social justice and civil rights organizations. I'm glad you asked the history question. Corporate social responsibility and corporate commitment, it was called in the early days, to equal employment opportunity, goes back to the 1960s and the civil rights revolution of that time. I noticed as I became a professional and became exposed to corporate America that diversity was seen, or equal employment opportunity or affirmative action was always seen as a compliance issue, as an avoidance of lawsuits, as an avoidance of government investigations by many. By some, it was seen, even the earliest of days, as something that was part of a company's commitment to the betterment and the best of the community. However, as I joined the National Urban League 17 years ago, their idea of diversity, there was a tremendous amount of talk about it. There were so many companies that had made commitments, that had built internal infrastructure with chief diversity officers, diversity councils, and the like. But there were also many stories and many instances where companies made commitments to diversity, to civil rights leaders and to the community, and promptly broke those commitments, ignored those commitments. When leadership changed, the new leadership said those commitments were made to a deposed king, and I'm the king now, and I'm not committed to those sorts of things. So the beginning of this was, we needed a way to ensure that diversity commitments would be real, binding, and significant. And the MOU takes a practice in business. What does business do when they are serious about any issue? They develop a plan. They outline a set of metrics. They put that in writing. If the work involves partners out corporation, they memorialize it in written agreements, letter of contractual agreements, memorandums of understanding. They may have various terminologies, but it's meant to be an agreement. So my point of view was, let's take what business does, the method that they use when they're serious about something, and apply it to the work of diversity and inclusion. And in the early days, it was my point of view that when we talked about it, it needed to go beyond a traditional idea that it's about simply equal employment opportunity or diversity in the workforce. And you know, we framed up in the early days that it is about governance, which means the board and the composition of the C-suite, that it is about procurement, which is where and how a corporation spends its dollars and its money. It is about personnel issues and issues of workforce and promotions and hiring. And it is about community investment or philanthropy. And then depending on the company's business, it might be about something else. In those companies that have broadcasting arms or more media arms, it's also about programming, etc. So the MOU, it was designed to create a process and a set of commitments and an agreement to stand up a plan and to measure that plan, an agreement to facilitate the advice and counsel and the accountability of the MOU signatories. And I really think it's a corporate innovation to do these. Those companies that have done these, and only a handful have had the courage and the willingness to do it. And I think if you would talk to those that did it early, around 2010 and in recent years, they would absolutely say we were committed, but this helped to channel our commitment. This helped to organize our commitment. This helped to ensure that we would follow through indeed on our commitment. So the MOU, and we had, it was an exciting challenge to negotiate this MOU with you and the team at T-Mobile. And it was an exciting challenge, and it was not without bumps along the way. It was not without hurdles that had to be overcome. And now we're at the stage of implementation. And so how does it help? It is about, for people of color, for Black people in America, it's about a seat at the table. It's about the right to participate in the economic mainstream of America. What does that mean? Jobs. That means upward promotions. That means responsibility. That means earning compensation on the same level as one's white counterparts and colleagues. It's about opportunities for our businesses out there who sell goods and services like everyone else, that they have a fair opportunity to participate in the procurement that T-Mobile does. It's about whether the philanthropy is aligned with diversity, because in a company like T-Mobile, the customers are indeed diverse. And that becomes a bit of the North Star for many of these companies, is the diversity of employees, the diversity of customers. So as we think about this, the benefits are for the company, the benefits are for the community, and all the National Urban League is a proxy for the community. We're an intermediary for the community. We want the benefits to flow to the community, to the business owners in the community, to the young emerging college students in the community, for the businesses that may work in more sophisticated spaces like financial services, technology, and the law, the professional services arena. So for those that may be cynics, for those that may say, what does it yield? I would say this. I said, what does it yield and whether it works compared to what? Compared to what you used to see in the past, which lots of talk, hollow commitments, and then frustration because there was no action. And I thought we needed to turn the corner. The leaders of America's civil rights organizations today are highly educated, seasoned, sophisticated executives with lawyers, ministers, people with backgrounds in public policy, people who've served in elected office, some who've served inside of presidential administrations, worked at the Justice Department. Our leadership is extremely talented, and I say sophisticated, and understand business. And we see business where business is diverse, where business is accountable to corporate social responsibility as being a plus for the community if we participate fully in the work that they do and in the opportunities that they create and in the products and services that they provide. And so I'm very excited about this. And Marie, you and Holly and others at T-Mobile have been absolutely great in working on this. And I know there's been great enthusiasm amongst the T-Mobile team, and now we have to get to work. And so during this LPC, we want to showcase to all who are listening what I call, this is the 21st century approach to corporate diversity and inclusion. It's a commitment with an MOU. It's particularly a great tool for those that are starting from scratch, who may have diversity but not made a tremendous amount of progress. For those companies that are more mature, an MOU could be, how do you elevate and expand? For companies that are in a mode of acquisition, how do you bring the values of diversity and inclusion to the new assets, the new companies that you may be purchasing and acquiring and adding into your portfolio? At the end of the day, I think there's a resurgence in America around the notion of corporate social responsibility. And I think it's a term that is inclusive of the idea of diversity and inclusive of the idea of inclusion.
I want to thank you for that. And I want to thank you and all of the organizations on here today. Thank you for partnering with us. And I would also just kind of make a call to action to, my fellow folks in corporate America that you need to engage with organizations in the community, especially more critical than ever that you have that engagement and that you leverage that expertise to help internally with your inclusion and diversity efforts. I think it is more critical right now than ever. It's always been an important issue. But I think, we owe a duty to shareholders, to employees, to customers. And I think a way of doing that really is engaging the community through these organizations. So I would just kind of urge folks who are watching today, who are in companies, pick up the phone, engage with these organizations, get involved with these organizations, because they really are on the ground servicing, the communities that we serve. So I want to thank, all of the panelists here. Janet, thank you. Sharon, I appreciate you. I know Reverend Sharpton, thank you. Domenico, thank you for going first. And Mark, and thank you, everyone here for your leadership on this issue. And, from T-Mobile, we really, like I said, again, we are looking forward to continuing the partnership with the new T-Mobile as we take it to the next level. But just I'm really looking forward to working with you all, especially right now at a really critical juncture at this time. And again, National Urban League and the National Urban League family, thank you for hosting this discussion. Thank you for letting me moderate this panel. It really is an honor to do this, to talk about this issue. This is something that is going to impact us, when we talk about, wealth disparity, when we talk about what's going on, with communities of color. This is impacting future generations. And so, just thank you all for doing what you're doing and fighting the fight.
And thank you, Marie, for being a great leader and for being the catalyst within T-Mobile for us to get to where we are.
Got to speak up, got to sit at the table. Thank you all.